online. Council members, please have your video on during the meeting and mute yourself when you are not speaking. We are live streaming this meeting through the RCDSO's YouTube channel so that members of the public, profession, and other interested parties can watch our proceedings. I would like to turn to the official opening of our meeting with a land acknowledgement. The RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples. These traditional lands are known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is home to many diverse First Nations, Inuit, and Métis people from across Turtle Island. This land is also part of the Dish with One Spoon territory, a treaty between allied nations to peaceably share and care for this land. We accept our responsibility to each other and this land we live on and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. We embrace the role we play in regulating dentists, in protecting the public interest, and in strengthening our partnerships with Indigenous communities to advance access to safe and equitable oral health. Thank you. At this point in time, I'm going to turn it over to Registrar and CEO Dan Faulkner to do the roll call. Dan?
Thank you, Hanno. Good morning, Council. Please be ready to unmute when I call your name. Patrick Ballantyne.
Present.
Nalan Bhargava.
Present.
Stephen Bird.
Present.
Ram Chopra.
Present.
James Colliver.
Present.
Peter Delane.
Present.
Daniel Fortino.
Present.
Neil Gajar.
Present.
Noha Goma.
Present.
Daniel Haas.
Present.
Iliad Horner-Parvar. Vivian Hu.
Present.
Nizar Ladak. Nizar has sent his regrets. Anthony Licio.
Present.
Anthony Mayer.
Present.
Harinder Sandhu.
Present.
Adal Simeon.
Present.
Brian Smith.
Present.
Osama Solomon, I know, is caught in traffic. He'll be here. Robin Somerville.
Present.
Rod Stapleforth.
Present.
Mark Trudell.
Present.
Aaron Walker.
Present.
Judy Welikovich. And Deborah Wilson.
Present.
Thank you. Back to you, Hanno.
Thank you. I'd like to ask Dr. Harinder Sandhu to provide the President's remarks. Harinder?
Okay. I'll start again. Thank you, Hanno, and good morning, everyone. I appreciate the opportunity to take a few moments to reflect on our work today and the role we play as Council. As Council is aware, today's meeting is being observed. A third-party evaluator is in attendance. This is part of our Council performance evaluation. An explanatory note was sent to all Council members last week. The work meets ministry expectations. It aligns with our approved governance framework. This is the second observation of two, and it builds on work already underway. The purpose of this evidence-based assessment is to evaluate our collective effectiveness as a council. And after today's meeting, members will be asked to complete an online confidential survey. Your feedback will inform the final report, and it will also support action planning later this year. Your participation and thoughtful engagement are always important, and I value the perspective you bring to the table. The strength of the college depends, in many ways, on the quality of Council's discussion. Before turning to some of the themes of today's discussion, I would like to pause to recognize some updates to our Council. First, I would like to formally welcome Mr. Stephen Bird as a new public member, appointed April 2nd for a 3-year term. Stephen Bird is a retired lawyer. For most of his career, Mr. Bird worked as a lawyer for a community legal clinic in Eastern Ontario. He has served for many years on boards of hospitals and health services in Perth and Southeast Ontario. He was recently on the board of the College of Physician Surgeons of Ontario. He has been a reviewer for the Canadian Centre for Accreditation and Imagine Canada. We are so pleased to have you join us. Council, please offer a warm welcome to Stephen. And he's going to get his council pin. It is also my pleasure to formally congratulate Mr. Ram Chopra on his reappointment as a public member of the council. Ram's reappointment took effect on February 26, 2026 for a new 3-year term. Ram has served the college with care and a strong commitment to the public interest. His work on the ICRC committee has been particularly valuable. His perspective strengthens our discussions. On behalf of Council, congratulations, Ram, and thank you.
Thank you very much.
I would like to take a moment to reflect on recent opportunity to connect directly with the members of the profession. I had the pleasure of attending an RCDSO Connect Live event in Ottawa, where nearly 200 members of the profession came together for an engaging session. The educational event focused on the application of the Foundations of Professionalism document. We discussed what it means in day-to-day practice. Events like this are important. They help build shared understanding, support professionalism, and strengthen trust between the college and the professions we regulate. I would like to extend my thanks to Vice President and fellow council member, Dr. Nalin Bhargav, for serving as the MC for the event. I would also like to recognize Council Member Dr. Erin Walker for her presentation on Foundations of Professionalism and for leading the panel discussion. In addition, I would like to thank former Council Member Dr. Nancy DeSanto, Chair of the Quality Assurance Committee, for her valuable contribution as a panel participant. RCDSO staff and panel members Dr. Rana Badway and Dr. Bonnie Yu did a wonderful job of explaining the importance of ethical guidance. Their collective efforts made the event a success, and I thank them for sharing their time and expertise. As we turn to work before us today, several of the issues we are considering speak directly to the future of the college. One of these is the ongoing development of the 5-year strategic plan. Having a clear and thoughtful strategic plan is essential. It provides direction during times of change. It helps ensure the decisions made today align with longer-term goals, and it supports consistency and accountability in how the college operates. This work is not only about setting objectives. It is about identifying priorities and confirming how we will continue to fulfill our mandate in the public interest. Council's role in this process is central, and your perspectives will help shape a plan that is both practical and forward-looking. We are also spending time on the draft standards related to managing new patients' requests. Standards are one of the key ways the college communicates expectations of practice. They help guide registrants and support safe and effective care. The management of new patients is a critical point in the care experience. It often sets the tone for the clinical relationship and influences the outcomes. Council's role in reviewing and discussing this draft is essential to ensure that the standard is clear, fair, and appropriate. Another important matter before us relates to a directional decision on real estate. While this may appear to be an operational issue, it is also a strategic one. Decisions about space affects how the organization functions. It impacts how staff work and are supported, and it shapes how effectively the college can deliver on its responsibilities. This is about planning for the future and ensuring that college is well positioned for what lies ahead. It is also about being responsible stewards of resources. The choice we make should support long-term stability and flexibility. Across all of these discussions, a common theme is stewardship. As council, we are entrusted with decisions that shape the college and influence its ability to serve the public. That responsibility requires careful thought, respectful debate, and attention to the long term. The matter before us today reflects that responsibility. I appreciate all of council for the wisdom that you bring to bear on our decisions. I would also like to take a moment to thank those who support council. I'm grateful to our registrar and CEO for his leadership and guidance. I also want to thank the staff of the college. Their preparation, professionalism, and commitment make these meetings effective and meaningful. Much of their work happens behind the scenes, but it is essential on behalf of council. Thank you for all that you do. Finally, I would like to thank the members of the public who are watching today. Transparency and public engagements are central to trust and regulation. We appreciate your interest in work of the college. Thank you. I look forward to our continued discussion. With that, Hanno, back to you.
Thank you, Harinder. The next item on the agenda is the declaration of the conflict of interest. Declaration of conflicts are a standard that is captured in the Ministry of Health College Performance Measurement Framework. Do any members of council feel that they have a conflict of interest, real or perceived, to declare for any of the agenda items to be discussed today? Thank you. Seeing none, the next item on the agenda is the consent agenda. As we have previously, we will be doing a roll call for all recorded votes, with the exception of this item, which is the consent agenda. As a governance best practice, we use the consent agenda as a time-saving mechanism. On the consent agenda are several items that are for council's information, acceptance, and ratification. Council will be asked to approve these in one single motion. Council may ask clarifying questions about an item on the consent agenda. If members wish to have a conversation about an item, we will take it out of the consent agenda and address it later on in our meeting. I would ask that you use a high bar when asking to remove an item from the consent agenda. The consent agenda items are in your meeting materials, starting from pages 17 to 107. Are there any questions or other changes for the consent agenda? Seeing none, I would ask that motion number 1 be put on the screen, please. And motion number 1 is that the items that follow from 1 to 9 be approved and or received for information by council. And that is moved by Neil, seconded by Iliad. All those in favor, please raise your virtual hands. Okay, and that motion is carried. Thank you. Item number 6 on the agenda is the Registrar and CEO's report, and I'm going to hand it over to you now, Dan, please.
Thank you, Hanno, and good morning again, Council. My first item of business, maybe while my slides are being prepared, I want to acknowledge Adele Simeon, a new public member who was appointed in December, and this is our first face-to-face meeting. So Adele, would you please come forward and receive your college pin? So I'm going to take you through a few highlights from what has been happening around the college. And for our newer members, typically what I try to do is give you an overview of some things that are happening in the external environment and also the internal environment to some extent. If you could go to the next slide, please. I won't cover everything in the report that you have in your materials, the written report, but I will try to cover some of it and also perhaps a couple of other different items that have come up since the writing of that report. First of all, what I'd like to do is to just display what we are calling at the moment a tagline, but you know that we have recently approved, council's recently approved a 10-year vision for the college, which will lead then to a series of strategic plans that are smaller and more action-oriented in their focus. And we have a broad vision for the college and a mission, which you can see on your screen. Those won't change, but we are looking at ways that we can better brand the 10-year vision. And so what you have before you is what we are going to be using in our designed materials as we start to publish the strategic vision, which is just over 2 pages. So it's really a concise written form of what you have seen, developed, and approved. So again, this is going to help us to be able to demonstrate what the college is about and demonstrate how we're moving forward and where we're trying to go and what we're trying to achieve. So that's here for your information at this point. Next slide, please. I want to talk about a couple of things happening in the environment. The first that some of you have probably heard about, and maybe extensively, is the new act, the new Regulated Professions Act called the Health Professions and Occupations Act in British Columbia. That came into effect on April 1st. It was introduced several years ago. It has been talked about since probably 2018, 2019, and it has really achieved a significant overhaul of regulated health professions in British Columbia. And some of the changes, and it is a very long, extensive act, which I'm only going to highlight at a very high level, some of the changes that are of significance. They relate, and they're in my report, to a reduction in the number of regulatory colleges from 15 to 6. So there have been amalgamations that have been in the works for the last in the oral health college space, it's been the last 3 years probably, and in the other colleges that relate to things like the professions of physiotherapy, occupational therapy, massage therapy, and so on, those have been in the works for the last year or two. There is now a superintendent that oversees all colleges, similar to a model that we see in the UK, which is the Professional Standards Authority. And it will provide oversight to colleges and likely have a series of reports or expectations of those colleges as well in their reporting related to all aspects of accountability and transparency and so on. All of the colleges, the 6 colleges, have government-appointed boards now, and there is an equal number of public and professional members, and there is now one disciplinary tribunal for all colleges in British Columbia. So these are some fairly significant changes. We have been watching those develop and have had many discussions with individuals who are in British Columbia and living this change. There are also some things that relate to the content of the Act, which again, very much a high-level overview and only trying to capture a few things to give you the sense of some of the changes that are happening. But penalties are changing, and they will be in some ways entrenched in the Act. There are sanctions now prescribed for those who knowingly provide false or misleading information to the public, and so it has become much more explicit in terms of the sanctions or the penalties. And there are also requirements for the colleges to approve and promulgate anti-racism standards. So some very significant and positive changes in terms of very clearly articulating what those expectations are in British Columbia, which we've also dealt with in Ontario. So we will be watching very carefully this act. These acts, because of the significance of them, because of the length and the complexity of them, they take many years essentially to really understand and capture, and you start to understand them by working within them and also through case law and other ways that you can really only imagine now, but we'll start to see as a system in the coming years and perhaps decades. But that is something very significant that all provinces are watching, and Ontario definitely is watching that. I also want to just mention CDAC, which is the Commission on Dental Accreditation in Canada. There has been a long history of this college's involvement with CDAC. This is the accreditation body that accredits educational programs in dentistry, dental assistant programs, and dental hygiene programs. It's a national organization, and over the last few years has had a number of challenges that this college has dealt with. You haven't heard about those in the recent past. I think probably 4 or 5 years ago, we were talking at this table about some governance changes that CDAC was making and its separation from the Canadian Dental Association. There are a number of initiatives that that CDAC is working on. There are also still a number of challenges. And just to ground you a little bit, CDAC is largely funded by regulators, which is a fairly unique framework for accreditation bodies. This college pays over $300,000 a year in grant funding to CDAC. So I have certainly been watching this very carefully. I want to ensure that this college gets value for money, and there's been many conversations about a number of aspects. So I don't want to delve into it too deeply today, and I will absolutely commit to bringing you more information back about some of the recent issues. But there are conversations happening where it's uncertain at this point if some regulators are going to drop their funding and perhaps even move out of the CDAC framework. And so there are a lot of different ramifications to that, which, as I said, I will bring back to you. There have also been conversations at our own federation for the dental regulatory authorities, so CDRAF. And I know we have new members, so I'm going to try and explain acronyms as I go through them. That's the Canadian Dental Regulatory Authorities Federation. And that is the body that includes all of the colleges of dentistry essentially across the country. So more to come, but I just wanted to alert you to that because we've seen a number of different challenges coming out of CDAC, and I want to make sure that you are as up to date as possible, and some more information will be helpful to that. Next slide, please. We are obviously obligated to provide information and reports to the Fairness Commissioner of Ontario. The Fairness Commissioner has been in existence in Ontario since probably 2007, 2008. Our legislation is very specific. We have to demonstrate that our registration processes are fair, transparent, objective, and impartial. And we provide an annual report to the Fairness Commissioner. We have done so March 31st. So our registration team under Hilary Bauer and Andrea Foti have again captured all of the information that's come out of registration, including data that looks at who's applying, who's being registered, mobility across the country, and so on. We have invited, and he has accepted, the Commissioner, Mr. Erwin Glassberg, and he will be here in person at Council on June 18th. So he will have an opportunity to talk to you, and you will have an opportunity to ask him any questions as well. And we'll provide you with some briefing materials in your package at the June meeting. We've also received honorable mention for RCDSO, and this relates specifically to work we've done to build more of an accountability framework for our national examination provider, the NDEB, the National Dental Examining Board of Canada. We have a memorandum of understanding with them, and they are achieving certain standards and expectations and service standards. It doesn't cover everything, but it really has been a great start to have conversations that are very specific to the issues that come to the Fairness Commissioner's attention and also to our attention, and really trying to make sure that there's accountability on any third-party service that we use, even if it's an examination body or CDAC, for example. But we haven't got to that point with a memorandum of understanding with CDAC yet, but it certainly is within the realm of possibility. So again, we have committed to all of the requirements that we have in legislation, and we've lived those for many years, and we will continue to do so, and I think you'll hear some positive words from the Fairness Commissioner at that time as well. Next slide. I want to switch now to PLP. All of you know that we transitioned PLP to Navicord on January 1st of this year. That was obviously a major milestone where the program transferred and the vast majority of staff moved over to Navicord. There are still continuing transition issues that we are working through with Navicord. There are conversations that we are having, and part of the agreement that we had with Navicord was to create an oversight committee, and we have done so. And that committee was formed in January. We have met 2 times. It includes Leslie Byrne, our Director of Communications, Jeff Goldberg, our CFO, and myself. And we meet with 3 representatives from Navicord and the unit or the subsidiary corporation that is actually running PLP. We have discussed a number of things, but clearly we're trying to make sure that some of these lingering items are addressed and resolved. There's nothing major. It's really just a complex transaction that's occurred, and we've had to make sure that even after January 1, that we're continuing to pay attention to making this the best service it can be for dentists and there to ensure that patients are protected. Some of the issues that we've discussed in the last 2 meetings are making sure that this portal is developed that will allow for dentists in the fall of this year to complete their annual renewal with the college, move seamlessly over to Navicord's system, pay their professional liability fee, come back to the college and finish their renewal. So that's not what happened in the fall of last year, but that's what we are expecting, and we'll do whatever we can to make sure that that happens this year as well. So that's been a lot of work happening, and we believe that we are on track to complete that and have testing done in the spring and early summer. And obviously, if there are any challenges, I'll make sure that you're aware. And we are wrapping up a number of other things that relate to the transition that are more operational. But more importantly, I think, is we're really trying to build some more strategic visioning around how the college and Navicord will relate going forward. And we're really encouraging Navicord to build a relationship with dentists, build a relationship with the association, and we're also looking at how we can best position education for dentists in the province, because the information that Navicord has, or any professional liability program has, the information that we have is so useful for members of the profession to know what works, what doesn't work, how to improve risk mitigation, and so forth. So we really want to build that relationship with Navicord, and the Oversight Committee is going to help us to move that forward. Next slide, please. I've titled the next slide just a bit of showcasing and learning, and showcasing about how we're trying to present to the other regulators, the public, the profession about the work, the great work that's happening here at RCDSO, and also the learning that's happening by all of our staff at all levels in many different ways. 4 examples are on the screen in front of you. CNAR is a major regulatory conference that occurs every year. It's a network that is growing, and typically over 1,000 people are at the conference that takes place in the fall. I can't tell you the acronym. I don't know it off the top of my head, but it is a major regulatory space where we learn so much, and we also give back. And in my report, I mentioned that we've submitted a number of different abstracts, and I expect we might, I hope that we do get a couple of approvals to present to the group on the great work that's happening in this college. The Canadian Oral Health Summit is, I think, a new activity or initiative. Andrea Foti and I went in June of 2024, and this is the subsequent event. I know Dr. Noah Goma was an instrumental person in designing that program and delivering some of the content at that event. And it really is a way for educators and researchers and regulators and other parts of the system in oral health care to come together, because it's beyond dentistry. It includes all aspects of oral health care, and really think about some interesting and challenging issues that we all face. And we're an organization with a mandate, but we live in a system. And we really need to approach some of our solutions that make care better for patients as a system and with partners. And so this is one way that we can do that, by participating in things like the Canadian Oral Health Summit. So that's coming up in June. The ODA annual spring meeting is coming up in the early part of May. We have a booth. This is, I think, our 3rd year in a row where we've had a booth, and we get a lot of foot traffic there. So some dentists or many other partners and other members of oral health professions, they happen upon us in the booth, and many members know that we're there, and they come over and visit, and they have specific questions. So we really try to have a good rotation of college staff and leaders from all the different areas, so we can answer any question that might be asked of us from the profession or others. So it's been a really great way for the college to be visible to the profession and lots of partners. And Dr. Sandhu mentioned RCDSO Connect Live, which is the event that we had in Ottawa in June, and a number of people were involved in that. It was a very significant and I say successful event where there was a lot of great feedback, and the content was really geared towards how professionalism is applied in practice in real life situations. So we had great speakers, we had great table exercises, and lots of really terrific comments from the individuals who attended. Next slide. Dr. Sandhu also mentioned the evaluation. I just want to emphasize it. We have our third-party evaluator, Sandy Varachia, who's here with us today. Sandy was in attendance virtually in December and watching the deliberations of council. We also had about 20 or so members of a citizens advisory group that is actually part of the Federation in Ontario for Health Regulators, where this large group of citizens are asked to come together on a number of occasions and really provide advice as members of the public about standards or different initiatives that colleges have. And we thought that we could build that into the observation of council to see how your deliberations and decisions meet the public interest. And so you will see that as part of the final report, as well as the survey that will come out to you tomorrow, which will ask you, it will take some time, maybe 30 minutes or 40 minutes, but it's really about how you evaluate your role on council, how you evaluate council as a whole, and also how you evaluate chairs, whether it's chair of this council or chair of committees. So again, we'll have a final report in June that you will have a chance to deliberate on. It will have recommendations, and out of that we'll develop an action plan. So it's all part of the college performance measurement framework, where we are expected to have a third-party evaluation on a 3-year cycle. And also just part of our own commitment to improvement of all aspects of the organization. Next slide, please. So I want to talk very briefly about some things that are happening around the college. Next slide. In your package, I won't go over this in any detail, but we provide to council at each meeting, each quarterly meeting, a corporate dashboard report. What we try to do is bring what we think are significant operational metrics that would be important for you to understand how we're doing. It could be because they've been raised as concerns by members of the public or the profession in the past. We're really trying to build out our transparency in some of the high-level operational issues. And what you see on the slide, but in the package where most of the data is, are across our regulatory functions, what metrics we are constantly measuring and trying to achieve. And you can see that we're not only meeting the metrics in many of the cases, but where we're meeting them or exceeding them, we're changing them. So we want to just keep trying to push our commitment to improvement and try to always get a little bit better. So we have lots of other metrics that our managers and directors look at on a regular basis, but for council, we just want to make sure that there are some that you're aware of, because I know some of you do get calls from members of the profession or the public, and so this is a way to demonstrate that accountability to you. Next slide. The picture here is of the Ottawa event. And I just want to talk about a couple of issues briefly. I know that council is obviously always very much interested in the culture of the organization, the work environment, and we have spent through all of our leaders and all of our staff a very significant amount of time in creating a workplace and a culture that is, I think, top-notch. And so a couple of ways that we do that is, we've mentioned before, staff engagement surveys every 2 years. Our next is coming up in the fall. We have provided you as well with high-level themes that come out of those surveys. We will continue to do so. And we've also looked at ways that we can continue to try to ensure that we have a psychologically safe environment for everyone. And one way to do that is through how individuals know they have a process, if they need one, to report on or submit concerns about conduct or behaviors that might not be aligned with or breach the code of conduct or some of our policies. And so as a final point in the procedures, we do have an external third party that we use where if somebody wants to remain anonymous, is not comfortable for whatever reason in reporting internally through supervisors or other directors, that there is a third party that would be able to take those concerns, and they have processes as well that would allow them to deal with that. So again, we're really trying to ensure that staff are able to feel comfortable and safe when there are issues or incidents that they feel they need to talk about or report. And finally, I won't talk about this in any detail. Communications is a huge presence at the college. I did talk a little bit in my written report about the past 3 months has been quite significant in terms of media inquiries. You will hear from Leslie Byrne, our Director of Communications, this afternoon, and she'll give you a broad overview of all the things that we do in communications, really trying to ensure that our brand is out there and that our mandate is attached to that brand, and also how we deal with lots of other things that relate to the website, social media, media inquiries, and so on. So you'll hear a lot more about that coming up this afternoon. And Council, that is my report, and I'm happy to take any questions that you have.
Thank you, Dan. Dan Haas.
Thank you very much, Dan. That was very, very informative. I do have a question regarding what you had spoken to with respect to CDAC and mentioning some of the regulatory bodies are reconsidering their relationship. And you said you're watching this very carefully. In the event of a change relationship with RCDSO and CDAC, I'm wondering what the mechanism is for that change. Is that a decision made by you as the registrar? Is it executive? Does it come back to council? How would that look if there is a change going forward?
So I'll say at the moment, we're not contemplating a change. We're not speculating on what the changes might be. Obviously, that would be a fairly significant decision that I would expect to at least bring to the executive committee, if not to council. There is language in the regulations around registration that does not require CDAC explicitly, but it does require accredited, a knowledge and approval of accredited bodies. So you can be assured that there won't be decisions made of that kind of significance that you presented without having a discussion with the governors.
Great. Thank you very much. Thanks.
Thank you. I have no other speakers, so if we could move on to the next item on the agenda, please. Item number 7. It concerns managing new patient requests. Material on the draft standard can be found in your package from pages 108 to 123, and this item is for Council's decision. Access to care is a priority for the college and was a key initiative under the 2023 to 2025 strategic plan. Access is a complex and multidimensional challenge, one that requires coordinated effort across many strategic partners. In the last phase of this work, our focus has been on establishing clear professional expectations. Beginning in 2023, we acted on Council's direction to develop 2 new college documents designed to clarify expectation for dentists. The first of these, Foundations of Professionalism, was approved by Council in September of 2025. We turn now our attention to managing new patient requests. This new draft standard of practice outlines dentists' legal, professional, and ethical obligations regarding new patient requests. At our February meeting, you provided input into the development of this draft, and today we will be presenting the first full draft. Dr. Aaron Walker, who is in the working group, will begin the presentation. And Aaron, I'm going to turn it over to you now, please.
Thank you, Hanno. Good morning. On behalf of the working group, I'm pleased to present the draft Managing New Patient Requests Standard of Practice. I'll start by providing you with some background information regarding how we got here, and I'll then provide you with an overview of the draft standard and what Council and QAC's initial feedback was. I'll briefly highlight our next steps, and then we'll turn it over to you for a bit of discussion. By way of reminder, the final phase of the Access to Care project under the 2023 to 2025 strategic plan focused on the development of 2 new college documents. Council directed that we develop professional expectations regarding professionalism and accepting new patients into dental practices. The Foundations of Professionalism was approved in September of 2025, and we've been considering and refining different versions of the standards since then. As a refresher, here are the phases of development that this standard has gone through to reach this point. And this is likely a familiar slide by now. You've seen it a few times. The process began with desktop research, followed by public consultation in early 2024, focused on professionalism and accepting new patients. Over the past few years, the working group carefully reviewed both the research and the consultation feedback and used that to inform the draft standard that you have before you today. Council expressed an interest in seeing this work early and on an ongoing basis. In response, the working group previewed key content that the working group was contemplating back in February to obtain Council's initial feedback. Now, Council is being presented with the actual draft standard for review and feedback. We're also seeking Council's approval to release the draft standard for external consultation. So now let's turn to what's in the draft standard. This is an outline of how the draft standard is currently structured. The executive summary, introduction, and principles provide important overview and context for the draft standard. And the standard is organized into two main sections. The first section, providing information, outlines dentists' obligations to provide information that helps individuals decide whether the dentist and the practice is right for them. The second section, dentist decision-making, sets out dentists' obligations for managing new patient requests to receive dental care. It's divided into two subsections, general requirements for non-emergencies and specific requirements for dental emergencies. There's also a glossary of terms at the end of the standard that defines the key terms. So now that we've walked through how the draft standard is structured, let's look at the key messages that underpin the draft. First, the draft standard emphasizes the importance of individuals having relevant information about the dentist and the practice to help them make informed decisions about where and from whom they receive care. Second, the draft standard clarifies that dentists are not required to accept every individual as a patient in non-emergency situations. However, dentist decisions regarding who to accept must be fair, non-discriminatory, transparent, and clear. And finally, the draft standard reminds dentists that they must continue to meet their existing obligations, both their legal obligations under the Ontario Human Rights Code and professional obligations when managing dental emergencies. The draft standard sets out dentists' legal, professional, and ethical obligations when managing new patient requests in either of the two situations: when an individual requests to become a patient of the practice, or when they need care on an emergency basis. Although we've used the term dentist, the draft standard is intended to apply equally to general dentists and specialists who receive direct inquiries from potential patients. I want to emphasize that this draft standard sets out requirements for managing requests that come directly from an individual. This draft does not apply to referrals from other healthcare professionals, which are addressed in the RCDSO's Most Responsible Dentist Practice Advisory. The draft standard sets out dentists' obligations to provide information that helps support the individual's autonomy and decision-making about where and from whom they receive care. Patient autonomy is one of the bioethical principles set out in Foundations of Professionalism, as you likely recall. The draft standard states that dentists must ensure that individuals receive a response to reasonable requests for information regarding the dentist or the practice, such as the scope of services offered, the registration class of the dentist at the practice, and the practice's policies and procedures. The dentist must also ensure that the information communicated is clear, true, accurate, and complies with existing requirements, such as advertising, accessibility, and duty to accommodate. The working group believes it's important to highlight dentists' legal obligations with respect to accessibility and the duty to accommodate when communicating information about services. Although these legal obligations have been in place for some time, they may be unfamiliar to some dentists, so the draft standard includes links to external resources to support dentists' understanding and implementation. The working group notes that office staff typically provide this information on behalf of dentists, but dentists are ultimately responsible for ensuring that the information is communicated in accordance with the standard. The draft standard explicitly states that dentists are not required to accept every individual as a patient. The working group recognizes that dentists may have valid reasons for not accepting an individual as a patient, including reasons related to their scope of practice or the capacity of the practice. However, the working group wanted to set out requirements to help ensure that these decisions are fair, non-discriminatory, transparent, and clear. The requirements include for dentists to consider whether they have the ability and capacity to accept the individual as a patient and refer out any elements of care that are outside of their scope of practice in accordance with the RCDSO's Most Responsible Dentist Practice Advisory. Dentists must consider whether any bias or prejudice might influence their decision-making and take reasonable steps to prevent it from having a negative influence on their decision. And of course, they must ensure that their decision aligns with their legal obligations under the Ontario Human Rights Code to provide dental services that are free from discrimination. The draft standard reminds dentists that they must provide services in accordance with the Ontario Human Rights Code. Again, the draft standard includes links to external resources to support understanding and implementation. If dentists decide not to accept an individual as a patient, the draft standard requires that dentists provide the rationale for their decision, if asked by the individual or the RCDSO. The working group believes it's necessary to require that dentists provide the rationale for their decision not to accept an individual as a patient, if asked. This promotes transparency and supports fairness in decision-making. The working group is mindful that as time passes, it may become difficult for dentists to recall retroactively the rationale for deciding not to accept a patient, as there's no requirement to document these decisions. The working group believes it would be helpful for dentists to remember their rationale if there's a complaint, such as to the RCDSO or the Human Rights Tribunal of Ontario. However, the working group is leaving it to each dentist to determine what approach will work best for them. The draft standard advises dentists to provide the individual with suggestions regarding where they can obtain oral health care where possible. The working group wants to advise dentists to help individuals look for oral health care to reduce barriers and support access to care. However, the working group does not believe it would be appropriate or practical to go as far as requiring that dentists actually find another oral health care professional who would be willing to take them on as a new patient. The approach strikes a balance between helping individuals access care and ensuring dentists are not burdened with unreasonable obligations. The draft standard reflects the RCDSO's existing requirement for dentists to manage dental emergencies for any individual who presents to them with a dental emergency. This requirement is found in RCDSO's Professional Responsibilities for Managing Dental Emergencies article, published in February-March of 2015. Managing the dental emergency could include the provision of emergency dental care or advising where emergency dental care can be obtained. The draft standard includes requirements for dentists to discuss the following topics with individuals who were not existing patients before the dental emergency. If there are any outstanding treatment needs that were observed during the dental emergency. If the individual wishes to receive ongoing care, and if the dentist will be accepting the individual as a patient to provide that care, and how copies of dental records concerning the dental emergency can be accessed or transferred if appropriate. The working group wants to set out requirements for dentists following the provision of emergency dental care to help support continuity of care. So Council and the Quality Assurance Committee have reviewed the draft standard at different stages of development and provided us with some feedback. As I mentioned earlier, Council previewed key content at the working group was contemplating for the new draft standard at our February meeting. At its March meeting, Quality Assurance Committee reviewed the draft standard and approved forwarding it to Council for consideration to release for external consultation. Council and QAC's feedback was thoughtful and constructive and reflected careful consideration of both the policy intent and how the draft standard will be implemented. While this feedback didn't result in immediate changes to the draft standard, many of the issues raised had already been carefully considered and addressed by the working group during drafting. The working group will consider all Council and QAC feedback alongside feedback received through the external consultation, and then will determine the most appropriate way to address it post-consultation. And this may include addressing it through revisions to the draft standard or through the development of companion resources. This approach is intended to ensure a comprehensive and coordinated response to all feedback received. So with that context, I'll now highlight key themes that emerged from the feedback we've received to date. So overall, Council and QAC were very supportive. Key themes raised included clarifying how this new draft standard intersects with existing college documents and guidance, including, as examples, the Most Responsible Dentist Practice Advisory, Dental Record-Keeping Guidelines, and Artificial Intelligence in Dentistry Guidance. Clarifying that the new draft standard applies to all dental practices, for example, corporate dental practices and solo dental practices, particularly in practices where dentists may not have control over decisions regarding accepting new patients, such as in a dental service organization. Building on draft content in the draft standard to clarify that dentists remain responsible for the information provided and decisions made, even when these are communicated or carried out by office staff on the dentist's behalf. Expanding the examples of information individuals may wish to know when deciding whether to become a patient, for example, practice ownership or the practice model or structure. Clarifying the scope and application of dentists' obligations, such as when an individual becomes a patient, and therefore obligations such as record keeping, ending a dentist-patient relationship will apply. Whether a dentist should document the rationale for declining to accept a patient, and how existing legal obligations under the Ontario Human Rights Code apply to practice policies that decline to accept public programs. Your briefing note includes responses to each theme. In summary, the feedback largely focused on clarification, implementation, and contextual guidance rather than substantive gaps in the draft standard. Some of that feedback had already been addressed during drafting, and other feedback may be best addressed through companion resources. So the working group made deliberate choices in drafting the standard, and feedback from the external consultation will help inform whether any of these choices should be revisited. Council also provided feedback on topics that were outside of the scope of the new draft, but will nonetheless be addressed in companion resources and considered as part of the review and development of other relevant college guidance. These topics relate to issues with referrals and coordinating care across multiple providers. Your briefing note outlines the specifics. 2 examples include situations where the referring dentist does not provide sufficient information about the patient, and when a patient requires comprehensive care beyond a specialist's scope of practice. Council's feedback on these topics will be addressed in companion resources and considered as part of the review and development of other relevant college guidance. So the next steps are as follows. If Council approval is granted today, the draft standard would be circulated for external consultation from April until June. The working group will then meet over the summer to review all feedback received, including feedback previously provided by Council and QAC, any substantive feedback provided by Council today, and feedback received through the external consultation. The revised standard will then come back to council at its December meeting for final approval. We'll also be developing companion resources such as FAQs and case scenarios to help support understanding and implementation. So that brings us to the two questions we have for council today. So first of all, does council have any further feedback on the draft Managing New Patient Requests Standard of Practice? And does council approve the release of the draft Managing New Patient Requests Standard of Practice for external consultation? I'll note that while we're inviting feedback today on the draft standard, no substantive changes will be made at this time, and any substantive feedback provided will be carefully reviewed by the working group after the consultation closes, alongside the feedback that we get through the public consultation to inform any proposed revisions. So back to you, Hanno, to facilitate some discussion.
Thank you very much, Erin, and thank you for that presentation, and to you and your group for the incredible amount of work you've done to bring the standard to this place. I am going to take some time to look at council if they have any feedback or areas for discussion, and Daniel Fortino, you're first on my list, please.
Thank you, Hanno. Thank you, Erin. That was an excellent presentation. Was there any discussion regarding empowering the patient to provide the proper information that's accurate, reliable, so that they could also make a decision if that's the right provider for them? And how do we determine that that information provided to the patient is accurate and reliable? Was there any discussion regarding sort of empowering the public to give them the knowledge to say, okay, this is the right provider for me, or it's not? Was there any discussion regarding that?
Yes, quite a bit. Maybe I'll bounce this back to Michelle.
Thank you, Dr. Walker. And yes, so as Dr. Walker mentioned, the working group did discuss this, and I think there was a real emphasis on ensuring that the information exchanged both ways, like from the patient to the provider and from the provider to the patient or prospective patient, is clear, accurate, because the working group really wanted to ensure that the relationship is formed at the outset based on clear information, and that it will set it up for success. So yes, the working group definitely considered that, and we can consider providing further clarity on this in the companion resources, I think, in terms of guidance for prospective patients, in terms of what information the provider might want to know about you, and emphasis on making sure you're clear and accurate about your needs and expectations up front, so that that relationship is established with that solid foundation.
Yeah, I think on us as regulators to make sure that information is reliable and actually accurate, to provide a good decision based on the patient and the dentist as well, that they're a good match for that practice. I think that's very important for the public.
Yes, thank you.
Thank you. Anthony Lisho.
Thank you. Very nice presentation, Doctor. My question is, in terms of accepting or not accepting a patient, well, accepting a patient is not an issue at all, but if a doctor doesn't accept a patient, could you just elaborate on how the documentation would be kept by that office? In other words, do they open a chart for that patient, and then are they bound by the same measures of keeping that chart for 10 years, even though they've never seen the patient, or, well, yeah, because sometimes they won't even see the patient and they decide they don't want to do it.
Yes, absolutely. So this is something that we actually spent a lot of time discussing, just for that very reason, because when somebody typically calls the office, if they don't end up following through with care, there is no chart. And it certainly, we didn't feel that it would be practical to open a chart or to document every single phone call that comes through the front desk. So that's where at this point, we're leaving it open for each office to figure out what works well for them. For example, if somebody calls the office and there's maybe a little bit more, more discussion, or the case seems at the outset a little bit more complex, or something stands out about the contact, then the office may want to make some notes about that particular communication. But our intent was not to overburden offices with having to do a lot of extra paperwork for every single phone call that comes through.
I totally understand that, but in situations unique, let's say, I had a unique situation. A patient came in, or an individual came in, and started asking all sorts of questions about the office. Do you do this, and how do you do that, and would I be able to do this, and so forth and so forth. That's the documentation I'm really referring to. And again, where do you keep that? It's not a chart. And how long do you keep it for? And it's a real dilemma. And I think that perhaps maybe some more thought could go into that.
Mm-hmm, thank you. We'll look into that.
Thank you. Stephen?
Thank you. I'm curious about the consideration of lifestyle of the potential patient. For example, a smoker is not covered by any human rights, I believe. And so how does a dentist deal with that? If they just don't want to deal with people who smoke, or don't follow instructions, they don't brush, or they don't do keep a proper diet, but in particular, smokers come to mind. So how do you deal with that?
Maybe I'll forward this one back to Michelle, because I think this is where we're a little bit at the intersection of ensuring that decisions are made based on what the office has the capacity to treat, and where we think that a relationship and treatment outcomes will be successful, versus applying bias to groups of patients, as opposed to ascertaining individual needs. So Michelle, do you want to weigh in on this?
Sure. Thank you, Dr. Walker. So I would say that the draft standard includes provisions, and I'm looking at provision 6 in particular, which begins at line 127 on page 120 in your materials. And it really requires that dentists think about whether the needs of the patient would fit within their scope of practice, and whether they have the capacity in the practice to treat the person. Talks about bias and not ensuring that bias or prejudice doesn't influence their decisions. And then, of course, what Dr. Walker alluded to, ensuring that the decisions are free from discrimination under the Ontario Human Rights Code. So the dentist would have to consider those three elements when they're making a decision about whether to take on this person who might have certain lifestyle, have made certain lifestyle choices, and whether, and I would say if that person's needs are within the dentist's scope of practice and they have capacity to accept that person into the practice, then the draft standard would suggest that the dentist do so, even though they don't necessarily agree with perhaps the person's lifestyle choices. So that's how I would see the draft standard applying to that scenario, and I would just put emphasis on not ensuring that bias or prejudice influences their decision about whether or not to accept someone as a patient. Is that helpful? Okay, thank you.
Thank you. Neil?
Thank you.
Neil, I think your mic is
Yes, my apologies.
okay. Thank you.
Very nice presentation. Thank you, Aaron. I think sometimes what biased and prejudice can potentially sometimes be read in the wrong way, and there potentially can be some liability here. There are times when you either have this gut feeling or your spider sense is tingling regarding a certain patient. I'll give you a perfect example. Sometimes when a patient walks in with a bag full of dentures, Doc, I want you to make me a new denture. Chances are you're not going to be able to make them a new denture. Does it become our responsibility to try to make a better denture, or how do you handle that, or do you refer it? Because then sometimes that is a bias, because somebody has seen a dozen so providers doesn't mean you shouldn't see them. Um, so I think it could potentially create more of a liability for members in the profession. The members of the profession are in the profession to practice dentistry, but sometimes expectations can't be managed or met. And so what do you do in that situation?
So I think what the standard does and how the standard helps in that situation is it requires dentists and patients to communicate about what the expectations are for treatment. And through this communication, then the dentist and the patient can come to a decision on whether the outcome is likely to be successful, and whether the dentist feels that they're able to meet the patient's needs and expectations in this situation. And if not, then this is where documentation is helpful. Michelle, did you want to weigh in?
Sure. I'll just maybe add to Dr. Walker's response, which I think was spot on, is that the dentist may not know necessarily at the outset if they're able to meet the patient's needs or the prospective patient's needs. So I would say, if the dentist tries when they establish a relationship, makes another set of dentures in your example, and if the patient still isn't happy, then you would look at potentially ending the dentist-patient relationship, which is governed by a separate standard of practice that the college has. So I would say, it may be challenging for a dentist to determine whether the relationship could be successful at the outset, but it would be maybe prudent to try to see, and then, as I said, if it doesn't work out, then you would take steps potentially to resolve the issue, and if not, ultimately end the dentist-patient relationship. So I just wanted to offer that we do have guidance on sort of the other end of the relationship as well.
Thank you. Ram?
The patients have the right to, once he or she is rejected by a dentist, they have the right to appeal, either go through the human rights area or complain to the college. And are we prepared to deal with complaints like this in the absence of any documentation by dentists?
Yeah, so I think this is similar to Anthony's question, and it is an issue that we did discuss quite a bit, because there typically isn't documentation for somebody who doesn't become a patient. So I think this is something that we'll look at based on Anthony's feedback and based on feedback that we get from public consultation on whether there's any more clarification that we can provide. But I think our intent in leaving it open to dentists is that if there are situations where maybe you do get that instinct or that gut feeling that there might be further communications based on the patient, then it would be prudent to make some notes or to have some mechanism to remember the reasons that this patient wasn't accepted. But the standard is currently, we're leaving it open for now. Does anybody from the working group or Michelle have anything to add to that?
I'll maybe, Noha, go ahead.
Yeah, thank you everybody for all the questions. So, I'm just going to add to what Dr. Walker and Michelle stated. The draft is really an invitation for dentists to potentially follow evidence-informed practice and best practice. So going back to Dr. Kajar's question about whether there would be bias in not accepting a patient who's asking for a new denture, well, justification of why a patient would not be accepted based on best practice would be prudent in this case. So so again, it's an invitation for and an encouragement for practicing dentists to follow best practice and standards of care.
Michelle?
Sure, and if I can just add to that, just because there is no documentation requirement in the draft doesn't mean that dentists could decide that they want to document those inquiries or conversations with individuals who want to become a patient that they might feel like they were tense or might result in a complaint to the college or to the Human Rights Tribunal of Ontario. So there's nothing stopping dentists from doing that if they feel like it might be helpful to make a note in their office, like as a memo to self even. So I'm not suggesting creating a record, although dentists may decide to do that. It's really up to them how they want to document. And just in response to the comment about is the college prepared to receive inquiries or complaints related to this when there is no documentation requirement, I would just note that the college may already be receiving inquiries and complaints related to individuals who weren't able to access a dentist or who were declined, and there currently is no documentation requirement, and those inquiries and complaints are adjudicated. So I just wanted to mention that as well.
Thank you. I currently have 3 people still on my speakers list. Anthony Mayer, you're next.
Thank you. I just wanted to respond to Neil's scenario, which I thought was excellent. My interpretation of this is if a patient shows up with a bag of dentures, it still behooves a dentist to examine the patient, because it's quite possible that every single one of those dentures in the bag does not fit well. And it's also quite possible that many of them fit as well as you could do yourself. And that once you make that kind of determination and record it, then it just makes whatever decision you make afterwards more justifiable. That's my point. Thank you.
Thank you. Jamie?
Thank you. I just want to remind everybody in the complaints process, documentation is read thoroughly and presented in a way that helps those adjudicating to make decisions. So I think it's a little unfair to the dentists to rely on recall. I think setting a standard for documentation in these situations is more a benefit to the dentist and also the public as well for understanding those reasons. I have seen complaints come through where dentists did not provide treatment.
Thank you. Osama?
I don't have a question. I just wanted a quick comment. I actually think the standard is perfect the way it is. You know, we're going to get so many different unique situations. And I think it has the right touch as is right now, with the balance of not being too specific, giving some direction. And because, we can come up with, 20 different unique scenarios. And when do you document? What if somebody has like a 10-second phone call and they ask you a quick question about something? Are you going to document that and make a chart for the patient? I think there is, it has to be up to the discretion of the dentist's office. And they're going to have to figure out at what threshold or at what point do they make, include their own documentation, and when do they actually, it'll be all over the map. And so I think as is right now, it's guts, but I'd love to see what the comments are with the profession as well, see what they think. But as is right now, I think it does have the right touch. So just my comments.
Thank you. Thank you again, Aaron, to you and your group, and thank you, Council, for your engagement. At this point in time, this motion, just a reminder that we're going to put on the screen now, is to approve consultation only. The consultation will be open for 60 days Council, you will see a revised version incorporating a review of feedback from Council and QAC, as well as from external parties at a later meeting. And Council, I'm going to ask that motion number 2 be put on the screen. You can all lower your virtual hand because we're doing a roll call. So motion number 2 is that Council approves the release of the draft managing new patient standard as set out in Appendix A of the resources for external consultation. That's moved by Ram, seconded by Stephen. And what we're going to do now, I'm going to turn it over to Dan in a moment to do the roll call. When Dan calls your name, please respond with either in favor, opposed, or abstain. So Dan, I'm turning it over to you now, please, for that roll call.
Okay, thank you, Hanno. Patrick Ballantyne.
In favor.
Nalam Bhargava.
In favor?
Stephen Bird.
In favor?
Ram Chopra.
In favor.
Jamie Colliver.
In favor.
Peter Delane.
In favor.
Daniel Fortino.
In favor?
Neil Gajar.
In favor.
Noha Goma.
In favor?
Daniel Haas.
In favor.
Iliad Horner-Parver.
In favor?
Vivian Hu.
In favor.
Anthony Licio.
In favor.
Anthony Mayer. Harinder Sandhu.
In favor.
Adele Simeon.
In favor.
Brian Smith.
In favor?
Osama Solomon.
In favor.
Robin Somerville.
In favor.
Rod Stapleforth.
In favor.
Mark Trudell.
In favor.
Aaron Walker.
In favor.
Judy Welikovich.
In favor.
And Deborah Wilson.
In favor.
Thank you.
Mr. Chairman, can we put the motion back up on the screen for one moment?
Sure, if we could have motion number 2 back on the screen, please.
So I see, and I was advised by my friend here, that it's missing the word requests. It's draft managing new patient requests standard. So the word request has been left out. Can we agree on a quick show of hands to amend the motion to add the word request, which is consistent with the briefing document?
Okay, so at this point in time, I will ask you to raise your virtual hand for that sort of friendly amendment.
I was going to say if anybody's opposed.
Okay.
No, it's fine. Everyone's raising.
Okay. Everyone is raising their hand for that friendly amendment. Thank you very much, Mr. Bromstein. The results of that motion, 24 people could vote, was 23 in favor, 1 abstention, so that motion is carried. So thank you again, Aaron, to you and your group, and thank you, Council. The next item on the agenda is item number 8, is a bylaw housekeeping amendment. This item is being brought forward by the Governance Committee and is for Council's decision today. The material for this item can be found on pages 124 to 163 in your Council package. And this item is for Council's decision. I'm going to turn it over to Dr. Dan Haas, Council member and member of the Governance Committee, to present this item. Dan, over to you, please.
Great. Thank you, Hanno, and good morning, Council. On behalf of the Governance Committee, I'm pleased to present the proposed bylaw housekeeping amendments for Council's consideration and approval today. This is a decision item, and to help us stay on schedule, I'll ask that questions be held until the end of the presentation, at which point there will be time for discussion. The amendments before Council are routine and non-substantive. They are intended to ensure that the College's bylaws remain accurate, up-to-date, and aligned with Council's prior decisions. The appendices include the proposed bylaw amendments and the corresponding clean, as well as amended, articles for Council's approval. Council is being asked today to approve the proposed housekeeping amendments. The proposed amendments address sunsetting the Professional Liability Program Committee, adoption of the Code of Ethics entitled Foundations of Professionalism, and correcting historical typographical errors. None of these changes introduce new policy direction or alter Council authority. They are technical updates that support good governance, clarity, and transparency. From a public interest perspective, maintaining accurate and current bylaws is foundational to effective regulation. Even routine housekeeping amendments matter because they reduce ambiguity and confusion. They reflect how the college actually operates today, and they reinforce public confidence in the college's governance framework. Keeping outdated structures or references in our bylaws, such as committees that no longer exist, undermines clarity and good governance practice. The first set of amendments removes all references to the Professional Liability Program Committee. As Council knows, the college divested the PLP program. Ownership transferred to Navicord on January 1st of this year, and the PLP committee completed its mandate and ceased operations in December of 2025. Retaining references to that committee in the bylaws risks misleading both registrants and the public about governance oversight that no longer exists. Removing those references confirms the committee's formal dissolution, eliminates ambiguity about authority or oversight, and ensures the bylaws reflect the college's current operating reality. The second set of amendments aligns the bylaws with Council's September 2025 decision to replace the former Code of Ethics with the Foundations of Professionalism. Articles 11 and 28 of the bylaws still reference the former Code of Ethics and therefore require technical amendment. These changes rescind the former Code of Ethics, replace it with the Foundations of Professionalism, and refer to the Code of Ethics in its new form and by its new name, and continue its status in the bylaw. This is an alignment exercise, not a policy change, and simply ensures that the bylaws accurately reflect what Council has already approved. The final category involves correcting minor typographical errors. During governance modernization work in late 2025, small errors were identified in articles that were not part of the December 2025 amendment package. These corrections do not alter meaning or intent. They are part of routine bylaw maintenance, and they support clarity, accuracy, and good governance practice. And while minor, addressing these errors avoids compounding confusion over time. In March 2026, the Governance Committee reviewed the full compendium of proposed bylaw housekeeping amendments in Appendix A and the corresponding clean versions in Appendix B. The proposed amendments remove all references to the PLP committee, rescind the former Code of Ethics and adopt Foundations of Professionalism, and correct minor typographical errors identified during governance review. The committee was satisfied that the amendments are appropriate housekeeping items. They align with Council's prior decisions, and no external circulation is required. The Governance Committee recommends approval of the proposed amendments. Subject to Council's approval today, staff will update the college's bylaws webpage accordingly. The amendments will take effect immediately. Additional housekeeping amendments will be brought forward to Council in early 2027 once electoral changes are fully implemented, including the planned removal of any remaining references to electoral districts. With that, I'll now turn it over to Hanno to facilitate and lead the discussion. Hanno?
Thank you, Dan, and thank you to your group. At this point in time, I'm going to ask if there are any questions for Dan and his group. Anthony Lisho, your hand is up. Okay. Well, the motion is on the screen first, but are there any questions first for Dan? Okay, so the motion for your consideration, Council, is that Council amend the bylaw articles set out in column A in the manner as set out in column A of Appendix B, with the clean as amended articles appearing in the form set out in column B of Appendix B. So Anthony Lisho is moving that motion. Mark Trudell, you're going to second it. Any other questions before we call the question? Again, this will be a roll call. So when Dan calls your name, please indicate your response either with in favor, opposed, or abstain.
Okay, we'll start with Patrick Ballantyne.
In favor.
Nalam Bargava.
In favor?
Stephen Bird.
In favor.
Ram Chopra,
In favor?
Jamie Colliver,
In favor?
Peter Delane,
In favor?
Daniel Fortino,
In favor.
Neil Gajar,
In favor.
Noha Goma,
In favor?
Daniel Haas,
In favor?
Iliad Horner-Parvar,
In favor.
Vivian Hu,
In favor.
Anthony Lischio,
In favor?
Anthony Mayer,
In favor.
Harinder has stepped out, Adele Simeon,
In favor.
Brian Smith,
In favor.
Osama Solomon,
In favor.
Robin Somerville,
In favor.
Rod Stapleforth,
In favor.
Mark Trudell,
In favor?
Aaron Walker,
In favor.
Judy Welakovich,
In favor.
and Deborah Wilson.
In favor.
Thank you.
Thank you. That motion required a two-thirds majority. 23 people were eligible to vote in this, and that was carried unanimously. So thank you again, Dan, to you and your group for that work and for the presentation. Council, we started behind schedule a little bit, but we've managed to make up a few minutes. The next item for your consideration is a motion to move into, it's a confidential matter, so it will be a motion to move into in camera. What will happen is we will entertain that motion after the in-camera session. Well, first of all, we will then have a short break, come back, deal with the in-camera matter. Following the in-camera matter, we will break for lunch, and we will return to the live streaming portion of this meeting at 1 o'clock sharp. So the next item for council's consideration is motion number 4, which I'm going to ask to have put on the screen, please. And that the public be excluded from the following portion of the meeting under clauses B and E of subsection 7.2 of the Health Professions Procedural Code, being Schedule 2 of the Regulation Health Profession Act, Ontario, in that financial or personal or other matters may be disclosed of such a nature that the harm created by the disclosure would outweigh the desirability of adhering to the principle that meetings be open to the public, and that instructions will be given to or opinions received from the solicitors of the college. I'm looking for a mover, and that is moved by Vivian, seconded by Jamie.
Can I just make a note that it's the Regulated Health Professions Act, not the Regulation Health Professions Act?
Okay, thank you for that. So we have a mover and a seconder, and for this one, I'm just going to ask you to raise your virtual hand. Thank you, and that motion is carried. We will break until 11 o'clock, then come back to entertain the matter in the in-camera session. We will then break for lunch, and for those people live streaming, we will see you back here at 1 o'clock sharp. Thank you. And for this group, we will be back together here at 11. Thank you. Welcome back, Council, and to everyone joining us from the live stream. The next item, item 10, concerns the college's future workspace planning. As part of its ongoing commitment to fiscal responsibility, the college regularly reviews all of its assets, including real estate. As you know, the college has a flexible workplace approach that supports both in-office and remote work for staff. The Finance, Audit, and Risk Committee is leading a review to assess long-term workplace needs and to consider how the current building at 6 Crescent Road or possible alternative premises can best support those needs. This item is for Council's decision and will involve a number of decision points, both today and in the future. The material can be found in your package from pages 164 to 171. And I'm going to turn it over now to Finance, Audit, and Risk Committee Chair Mark Trudell to offer a presentation. So Mark, over to you, please.
Thanks. Are we good? We're good. Thanks for allowing me the opportunity to present this information to you this afternoon, folks. The goal. So the goal is to explain the thinking behind the college's workplace planning and its property at 6 Crescent. It's the information you're going to be witness to here shortly really reflects the work completed by FAR, by the staff of the college, and by external advisors. And that's the result of several years, not several months, several years of analysis. That work's about aligning the workplace, the strategic vision, and stewardship. Those are the key operative words. And ultimately, that work supports the college's ability to serve the public's interest effectively. So in this presentation, we're going to focus on the why this matters, the opinion or the options that were explored, and the decisions that are being asked of council this afternoon. What I would ask you to do is to focus your eyes on the screen and not on me. Consider me to be the speaker at the back of the room and the presentations to the sides and to the front. So the slide in front of you. The college is a little bit on history. The college purchases the building in 1991, and much has changed since that time. There were conversations about renovations and modernizations that started back in 2014, as early as 2014. There were some urgent renovations that were completed in 2016, but they were partial and they were somewhat reactive in nature. And then along came the pandemic, and the pandemic fundamentally changed how and where staff work. And since 2021, since the pandemic, the college has operated, as you're aware, in a hybrid environment. In 2024, the college evolved and formalized the work environment policy with what we refer to as the flexible work culture framework. That was 2024. Next slide, please. The objective. So our workplace should visibly support and reflect our organization's strategy. Space needs to support the college's culture, its values, and the way it works, and the college's long-term needs. This is really required whether the college remains in the building or not. The college needs space that supports both in-person, hybrid, and remote collaboration, all three. And it should reinforce professionalism and our role as a college as a regulator. Next slide, please. So we start with the needs assessment, having the objective defined. I'd like to chat a little bit about the needs assessment process. So to prepare, we engaged Colliers to develop a workplace advisor, and particularly at Colliers, not their real estate group, but their workplace advisory practice. They have a management consultancy that's focused on workplace advisory services. They helped us develop and later revise our workplace strategy playbook. And that playbook establishes principles for space design, for efficiency, and the organization of our workspace. Again, a workplace strategy playbook. The content of that playbook is tightly linked to the college's strategic vision and its priorities. And the analysis of that work, the analysis all pointed to roughly a reduction of 40% in usable square footage. So that is to say, the current footprint of the premises that we own at 6 Crescent, our occupancy needs are essentially 40% of that footprint. And that revised playbook reflects the best practices as of a date of January 2026. That is to say, it is current. Next slide, please. Where RCDSO staff reside, where do they live in relation to the college's property? Geography matters. It certainly matters when we think about accessibility, environmental impact, and the burden of commuting. So if you look at that map, more than 40% or correction, more than 50% of the staff live within 15 kilometers of our current location. Greater than 50% of the staff within 15 kilometers of our current office location. So that metric supports continued presence either downtown or midtown in terms of physical location, based solely on that metric alone. That data reinforces also the importance of access via transit, public transit. And it also provides us with, really informs us in terms of our future lease considerations. Where, if we are to move, where should we move? Staff proximity, though, is only one of several, not the only, one of several factors that we considered. There are 9 criteria that were in your briefing note, which I'm presuming you've had an opportunity to review, and I'll walk you through some of those criteria on a later slide. Next slide, please. So that's where the staff reside in relation to the office. Where are the system partners? What do I mean by system? I'm referring to health profession regulators and the province, the provincial agencies. More specifically, the blue dots on the screen, if you can see that, the blue dots represent health protection regulators of Ontario, the colleges, HPRO colleges, and they're all downtown or midtown. The orange dots, well, that's Queen's Park, that's the Ministry of Health, that's Public Health Ontario, that's U of T, that's ODA, and so forth. Orange dots. Proximity to Queen's Park, proximity to the Ministries of Health, and other partner organizations. Proximity supports collaboration with those agencies. And collaboration with those agencies is documented in our 10-year vision. Proximity to each and every one of those organizations facilitates and eases system dialogue and change. It really substantially facilitates, induces, enhances collaboration with those agencies. Next slide, please. So we've spoken about where staffers, we've touched on the objectives. We've spoken about where staff reside, where the partner agencies are located. Let's speak a little bit now about the work done by FAR in relation to this activity, this initiative. It's been a standing item on FAR's agenda over several years, arguably. Our first step was we engaged Colliers to discuss efficiencies and future workplace planning. I just spoke to that a few minutes ago. And we developed that playbook. And that started in 2021, 5 years ago. Options were reintroduced and refined in terms of the where to, the why. And that work was carried out in post-COVID, 2023, 2024. And that work then was complemented by studies that were commissioned involving third-party experts. Those include feasibility studies, engineering studies, the likes of geotechnical engineering studies to establish soil, foundation design, the integrity of soil beneath the building at 6 Crescent in terms of a future and higher use, environmental studies and environmental site assessment in order to establish whether there's any third-party liabilities associated with the property, either attributed to historic operations, abutting property use, transit, which would impact on the valuation of the property, and also, if nasty enough, they would impact on the occupancy, continued occupancy of the property in terms of environmental contaminants. We commissioned a building condition assessment, which essentially is at a very high level a review of the physical condition of the electrical, mechanical, structural, civil related elements of the building envelope. What condition is the building in terms of expenditures to be? And then, as you witnessed earlier in today's meeting, we commissioned a tax opinion in relation to this potential transaction. Now, council has been briefed on this information on more than one occasion leading up to today's meeting. And this analysis, as you can tell by the tone of my voice, has been very deliberate, very intentional, and very well documented for the record. Next slide, please. Options. What options in terms of did we consider in relation to occupancy? Well, we looked at multiple options, and we looked at them in depth over a 3-year period, starting with the do-nothing option. But we concluded that that was not considered viable. Do nothing does not mean status quo. It means remain, but substantially renovate and improve upon the current condition of the asset. We looked at highest and best use of the property in terms of options. Rezoning, and that was discounted because of the cost. That cost in excess of $1 million in terms of achieving the necessary approvals, out-of-pocket costs, some degree of risk. The timelines and the complexities, all of which are really not the main menu of the college's role and responsibility as a regulator. So that left 2 viable paths. Renovate the existing asset, or divest, sell, and relocate. Those are the 2 options that we deem to be viable amongst the options considered. There were pros and cons for each. They were discussed in previous council meetings. We've kicked this around. And most recently at our February 2026 meeting. And on top of all this, staff and Colliers continued to hold informal, meetings and drop-in sessions that you were invited to participate, most recently over the course of the past month, in order to provide you with further information and to seek further input from council. Next slide, please. Assessing the strategic value. Well, regardless of the option, space modernization is required. The do-nothing option is not literally do nothing. It is stay put and renovate. Space modernization is required, achieved either at 6th Crescent or achieved at an alternative location. Well, I made reference to the building condition assessment work that was carried out to assess the current physical condition of the building, the status of the electrical, mechanical, space utilization. We talked about 40% occupancy as the current need in light of the hybrid model. So the current building does not support how we work today. It doesn't support it based on the footprint size. 40% is all we need. It doesn't support it based on its current physical condition and its current layout. So we must consider both present operations and future needs. Agility, adaptability, scalability are critical selection criteria. We are in a hybrid model right now. As time evolves, who knows where that leads to in terms of the level of occupancy. Who knows where the future of the regulatory agencies that are aligned under oral health, whether at some point in time they come together or they don't. Essentially, flexibility, adaptability, scalability are key critical selection criteria. This decision isn't just a financial one, it's a strategic decision by council and the college. So the question is, which option best supports those long-term objectives strategically? Next slide, please. So we're down to these 2 options, at least through our analysis at FAR, and with the support and concurrence with the third-party advisors. Keeping or selling? What are the implications? Well, if we keep the building, it means renovation, as I've stated previously. And that renovation, the value accrues, but it only accrues to the college, the value in terms of the value of the asset. But even if you renovate it at substantial cost, as time goes on, that building will continue to age, and thereby requiring additional capital expenditure at some point in the future. Interior renovations will be dated, and they will be on the college's tab, because the college will continue to own the asset. Those renovations, if we stay put, will take not months, but they will take in the order of a few years. And those few years will delay cultural alignment of staff. They will be a substantial disruptive factor in terms of the business operations, the operations of the college, while these renovations are going on, inside of a building envelope that you continue to occupy. The building design, it limits efficiency. The floor plate, the inherent layout, those of you who have been to the college, most of you, all of you, you know that the minute you walk in the door, you're faced with being shuttled towards an elevator. And the wall that you're staring at, behind which is a ground level parking garage, that template just doesn't align with, it's not conducive to an occupancy that we are looking towards. It's a design that dates back to the 70s, where the working model was different than it is today. So the building doesn't lend itself, even if renovated, to a model that we feel is conducive with regards to enhancing staff participation. Selling the property provides capital to foster and fund strategic initiatives. It allows, from a design point of view, for a clean slate to start with, and to execute, from a construction engineering point of view, to execute in a much shorter time frame than trying to do it within a building that you continue to occupy, with a template and a floor plate that at the end of the day still isn't going to be optimal vis-a-vis what our workplace strategy playbook indicates. Next slide, please. So, why selling now is in the best interest of the college? Question mark. I mentioned earlier that selling unlocks capital, otherwise non-liquid capital, capital that is tied up in bricks and mortar. It unlocks that capital for core regulatory work that otherwise would not be available. It supports long-term financial health and, I would suggest, stability in professional fees. Not reduction, stability in professional fee. Building ownership, at the end of the day, is not a core business of the college. And keep in mind, I mentioned 40% of the footprint of the existing building is necessary for the college to carry out its duties and responsibilities, which therefore means by default, you either continue to pay utility costs and taxes on a building that is less than half utilized by the college, or you become by default a landlord and you have a tenant. And I repeat, is that part of the core business of the college or not? A future sale of the building, ironically, may be inevitable. Either now or in the future. We do not know what the future holds. But there's a distinct likelihood that either as a result of a change in direction of the province, an amalgamation of certain regulatory colleges, or both of the above, those elements may or may not trigger a future sale at a later date rather than at the present time. Alternatively, leasing the occupancy required, provides a great degree of flexibility. It provides a great degree of agility, all of which can be built into the choice and the selection of the location and the terms of reference with the landlord. Let's talk about current market conditions. They favor redevelopment of our property for residential use. Highest and best use of 6 Crescent is not 5-story office commercial. It's residential high-density tower. And, you know, in terms of the housing and the need for housing, it stands to reason that the current market conditions favor the redevelopment of our property. At the other end of things, from a leasing point of view, the market's good right now. But that vacancy is starting to tighten up. As you're aware, many of the large institutions, financial institutions, have mandated back to work for their employees. So it's dynamic, but there still is a window open and a window of opportunity. It still is a tenant's market at the present time, but that may change dramatically in the coming year, given the back to work mandates that others in industry are now implementing. Next slide, please. So amongst those options, what were I mentioned earlier, the decision-making criteria. On the slide, you can see that FAR evaluated all of those options against, or all of the options I spoke to against the criteria that you can see on the screen. And the outcome of which was selling the building ranked highest amongst each and every one of those options evaluated. I repeat, selling the building, selling the property ranked highest amongst each of the options that were evaluated. The criteria balanced financial, operational, and strategic factors. This was not a single criteria recommendation. There are multiple criteria, all of which were considered. In this evaluation, multiple criteria forms the basis of FAR's advice to council that is being submitted to you today. Next slide, please. Let's talk a little bit about some details, some metrics arising from those recommendations. Specifically, the sale of the asset and leasing the occupancy, the premises. These estimates that you see on the screen are based on an 18,500 square foot footprint, 18.5, corresponding to the needs assessment in terms of how much space we need comfortably, factoring in current and foreseeable future. Our operating capital costs, collectively, the total is just over $1 million annually, operating and capital cost expenditures in relation to the property. Alternatively, what's the cost to lease in today's market? We estimate it'll come in at around 1.2 to 1.3 million annually, plus HST. And that factors in something in the order of a 10-year term lease. You're going to witness one-time sale and transaction costs that are outlined on the screen. The tenant improvement costs that you see on the screen, from a negotiating point of view, there's a good, strong likelihood that they will be shared with and potentially substantially absorbed by the firm that we end up leasing with, the landlord. And that landlord will amortize those costs over the term of the lease, arguably a 10-year term, which speaks to the capital outlay that otherwise we would be faced in terms of those leasehold improvements. So overall, that financial picture is manageable, it's predictable, and correspondingly, it's attractive. Next slide, please. With our our tax advisors and accountants, we touched on the topic of financial reserves, and we've had that discussion as members of council over the last number of months. Yes, a sale would generate, new funds, new proceeds. The tax advice that you were party to earlier today in camera supports using those reserves strategically. So the intent is to prepare for the future and advance the vision. FAR and staff, we would focus on developing a reserve policy with council and governance oversight as our colleagues at Tinkham emphasized, government oversight remains central to this process so as to maintain the college's not-for-profit designation. Next slide, please. Touch on a few leading towards next steps and the work that we've already done leading towards the next steps. Should council decide to proceed further in terms of the recommendations of FAR, a broker, a real estate service firm, would be required both to address the leasing aspect, to identify, find premises that are ideal and suitable to the college to address the college's needs, and a real estate service firm to coordinate and manage the sale process of the asset, of the property. So two functions. To that end, FAR reached out and solicited competitive proposals from 4 well-established professional realty firms. All those proposals were evaluated, each and every one based on fee, based on the strategy that they advanced, their work experience and knowledge of the market, and their legal terms of their contractual terms of reference. So we did this quite analytically, essentially, and Colliers scored strongest on all counts. Coincidentally, Colliers also has a pre-existing operating relationship with the college, if you'll recall, going back several years. So there's been a good terms of reference, and that has been a good experience to build on. So having identified Colliers as the preferred supplier of choice for both the leasing and the sale, we examined legal agreements, contractual agreements that they put forth. They were vetted by legal and by our staff, in particular our financial staff, starting with our CFO. Appropriate protections have been built into both agreements, protective of the college. Next slide, please. So what are the next steps? The next step, if you follow on the recommendation of FAR, would to formally commence leasing inquiries and the exploration, I underline that word, exploration of the sale of the property. Both initiatives, are not forcing the college to transact, neither to lock into a lease, neither to lock into a sale agreement. They are intentional to develop data, key data, so that this council's best positioned to make a well-informed decision. To get that data, hard data such as, do we have genuine offers for the property, tangible offers, legally binding offers, and what are the numerics? What are the dollar values? As opposed to estimates and general appraisals. Ditto with regards to leasing options, tangible locations that check all of the boxes that our workplace strategy playbook have flagged, so that that information can be presented to council, both options in terms of narrowed down options, say 2 or 3, in terms of what alternatives exist to move into and what are those terms, and ditto with regard to the sale of the property, so that when the time comes, should you make a decision, you will make a decision that's well-grounded, well-founded, based on factual information, detailed metrics. So in closing, the recommendations about alignment with the college's vision and strategic plan, and it's about stewardship. Stewardship in terms of maintaining, respecting the public's interest. These recommendations we're putting forth today reflect how the college works today and is trying to plan for tomorrow. Selling the building creates flexibility, creates some agility, and it truthfully creates opportunity. Today's decisions that are being, the motions you will see being put to council will enable staff and FAR to go to work and to bring back data that'll allow council to make an informed decision at a later point in time with regards to where do you move to and what does the math look like. Next slide, please. I think we're there. Motions. So I would like at this point in time, there'll be an opportunity for Q&A, but I am now at this time going to stand down in terms of the presentation. And I would like to call upon our Chair, Hanno, to present to you, members of council, the motions that are being put forth by FAR for your consideration, respectfully. Thank you for your patience, and thanks for listening through this.
Thank you, Mark, and thank you to the work that you and your committee have done for this presentation. Council, we have about 15 minutes for discussion before we move into the motions. So at this point in time, I am happy to start speakers list if you have questions or comments that you wish to make. Judy.
Yes, thank you. And thank you, Mark. That was a really excellent presentation. I have to say, I can't say that I'm completely on board with the FAR recommendation. I have some serious concerns about selling the only asset that we have in order to fund strategic initiatives, which to me is selling the only asset we have to fund operating expenses. And I also wanted to note that residential redevelopment is slowing down. I know this from personal experience based on my position as chair of another board where we're in the same situation. And I think that we have to think really long and hard before we, as I said, sell the only asset that we have. Because that then becomes a dwindling asset, and at some point you're out of asset. And then what do you do? You're not in a strong position to borrow money at that point. Not that you necessarily want to, because can you really afford the borrowing costs? So, as I said, I have some serious concerns with the proposal, but I'd like to hear what others have to say.
Okay. Thank you, Judy, for those thoughtful comments and for the courage to share those with us. I would just like to respond by looking at it through my lens. You're right, bricks and mortar and dirt, that's an asset. The proceeds from the sale of that asset are cash. And the cash is an asset from an accounting and actuality. So I'm just bringing to everybody's attention that the objective here is is essentially trading one type of asset for another in that respect. Secondly, that the proceeds would be managed in an extremely stewardly manner as opposed to frivolously dispensed, bleeding in a matter of months and years with nothing financially to show that, through my lens as a council member, is not the playbook and not the intent. In fact, if anything, bolstered by the opinion from our accountants, is to be extremely diligent with regards to the stewardly management of the proceeds of arising from the transaction. And that might look like, I might add, that might look like where we don't spend any of those proceeds, but we do benefit from conservative investments and the dividend accrued from the management of those funds. Just looking at it through a different lens, and just wanted to share that as a response, but not one that's intended to be challenging or confrontational. Thank you. No, for my part, though, I'm saying thank you.
Dan Haas?
Thank you, and thank you for the presentation. It was very, very informative. So my understanding is we will be asked to consider a motion to really formally proceed with exploring these possibilities without committing to anything until we get information back. And I guess my question is, what kind of timeline are you looking at? When will we get information back to make a decision on next steps? Roughly, what are you looking at?
Well, I have a number in my mind, but I'd like to reach out to staff and solicit their input rather than just cavalier throw a number out on the table. When do we expect to see some producibles from Colliers in terms of leasing and as firm offers in terms of the properties if we contract in the next 30 days?
Yes, so if we bring Colliers on board and council approves the motions today, we will enact FAR to work with Colliers right away. There is some due diligence that we have to do on the selling side and get the marketing materials together, get the advertising materials together. So that takes, I would think, 6 weeks to 2 months. And we need to start on the leasing side, start touring properties and coming up with viable alternatives. So I would think it's going to be a couple months, but it shouldn't be, 6 months or anything like that.
You might see some information in 6 months from now. The window would look like 6 or 12 months.
Mark, if
We can't hear you.
you need to speak into the microphone so that we can all hear you.
My apologies. So, Jeff, I think the takeaway is at a minimum from 6 months from now to a 12 months. So a 6 to 12 month window.
No, sorry, Mark. I think 6 months would be maybe the outside time frame,
All right.
but it's hard to tell without
It's hard to tell.
consulting
but-
with
but
Colliers.
in general terms, and we really should ask our advisors, Colliers, to weigh in on this, but we're left with the impression that council might witness in as early as 6 months from now, the hard data. That in terms of detailed information, to make if it chooses to make an informed decision at that time, but you would be empowered with additional information, hard data, in terms of leasing options and the metrics, distinct from firm offers in terms of reference with regards to the building. And you are absolutely correct, Dr. Haas, the motions are not committing council to transact and make final decisions. The motions are simply providing FAR and staff with the instruction and authorization to proceed with gathering the information necessary for council to make informed decisions. And to Judy's point, that decision may be stand down, may be not to proceed with transacting or leasing. But you will be empowered with additional information. So the ask today, to repeat, Dr. Haas, you are correct. The ask is not authorization of proceeding and commit to transacting, selling anything. The ask is to empower us to sign a contract with Colliers, the terms of which are non-binding and, I might add, non-binding both in terms of commitment and no financial liability.
Great, thank you. That's helpful to know. Thank you.
Thank you. Peter Deline?
Yeah, Mark, I was wondering if you could talk a little bit about the political climate and how that affects a possible either sale or development of a building.
Thank you, Peter. That's so when we refer to the word political climate, we're referring to essentially the potential redevelopment of the property for highest and best use, and how amenable both at the municipal level, the municipal ward, Rosedale, and the province, how amenable those two agencies are to support an application for a zoning amendment for a higher and best use that may be limited to the footprint of our property, but may encompass abutting properties fronting Yonge Street. To my understanding, both the ministry and the city are very supportive of creative ideas with regards to enhancing availability of housing. And I think at this point in time, there's a lot of support politically, to my understanding, both in terms of our clients that are busy doing redevelopments. I might add, you've heard it before in our discussions, that Sixth Crescent is not a standard location or property. It's a coveted location based on its physical location. So notwithstanding what's happening in the market right now, we all hear about things like an excess of residential condos and so forth. The redevelopment of this property, and this, given its physical location, at the present time or deferred to a later date, just simply the physical location is highly attractive to developers. And Colliers has supported that. They have, shall we say, on a non-committal basis, had discussions with third parties on a no-name basis, and certainly been left with that strong opinion as well. It's a sought-after location. Correspondingly, we believe the municipality and the province, and they're prepared to take the risk. We explored the not redeveloping it, but changing the land use, rezoning. We explored that as an option. We looked in detail at the cost, and I think we all concluded that we weren't prepared to accept that risk, that financial risk, the cash outlay for approvals, no 100% score of success. It's not our space, it's not our business. And it's a risk that we don't necessarily need to take on, the rezoning for highest and best use. Does that address your question, Peter?
Yeah, I was kind of interested in how the density would be affected, by the political climate. If the municipalities were more amenable to higher buildings or more density in the residential.
The case studies that we have been presented with to date, including in close proximity to one particular file in close proximity to ours, strongly support that both the municipality, one in Roxborough, I think is the address, strongly support the intensification. And you are aware from previous discussions and meetings, and with the exception of new members of council, there was a massing study that was carried out. So we looked at density, we looked at height, all of which were strongly supportive of the redevelopment, highest and best use, other than continued current use, distinct from continued current use. Thank you.
Thank you. Nalan?
Okay, thanks, Mark. That's a great presentation. A lot of information there, so a lot to unpack. And we've chosen, it looks like, to separate the two issues. The sale of the building, that's issue number one. Issue number two is what to do with the proceeds after the sale. So we're going to deal with those separately, and that's fine. However, I just want to make two comments that we should all consider for step one. So one, if you look at the history of the RCDSO, there's many hands who had a part in getting us to Crescent Road. So we should be prepared to answer some questions when we do sell the property. So just looking at the history, the RCDSO, look at all our addresses, 46 Church Street, 13 Louisa, King Street West. Those are paid for by the ODA. That's who funded our location way back in the 1870s. Then 240 College Street, when the RCDSO actually taught we were a college, there was money put in by the Ministry of Health, I believe, and perhaps National Defense, because we were tasked with educating returning soldiers after the First World War. Then the building was given to the University of Toronto. Then 234 St. George, we were a tenant in the Canadian Dental Association building and possibly received lesser rent, like possibly received subsidized rent. Then we moved to 230 St. George, and we had tenants. The tenants were the ODA and CDSPI, again reducing our costs. So I'm not saying any of these people have claim to 6 Crescent Road, but we should be prepared to answer questions from any of those groups in terms of a communications strategy. That's the first point. The second point is, through all of these buildings, there's been a legacy since 1875, 1876 for the RCDSO. Many people have had a hand in building the asset that is now 6 Crescent Road. And so Judy makes a good point. What are we going to do with the sale, with the assets after the sale? So, and I think Dan spoke to the same point this morning. How are we going to communicate that? Because it's one thing for us to make decisions here, but when you go out to the dental community, somebody is going to put their hand up and say, hey, isn't that our money? Shouldn't we get it? So again, be prepared. So one thing I think would be great is we have to create a reserve fund. We should create a reserve fund to buy a new building. I'm not saying we have to buy a new building, but it puts so many questions to rest. So just 2 considerations we make as we go forward. And thank you, good presentation.
Thank you. Vivian?
Thank you. I just have a question. Great presentation. Learning a lot more, and it's a big decision for all of us to make. I know that there has been a lot of talk about if we were to relocate, it has to be pretty much around the same downtown, close to strategic plan, strategic members or partners. I was just wondering, what's the percentage of people that actually physically need to get into the building versus most of the transaction maybe just virtual? So why the need?
So the question is, to my understanding, why the need in terms of 18,500 square feet, which is where the study landed?
It's about proximity.
Proximity, yeah.
Proximity.
Why we need to be close to those stakeholders.
To stakeholders. Well, interrelationships and fosters communication, fosters networking. I understand your point. I don't think when you looked at the map and what I call the heat map or density map, I don't think it's just haphazard that they all coincidentally across the entire province of Ontario land within a fairly tight radius arm. I think that's intentional on their behalf. So I'm not sure I'm directly answering your question, but I think the answer lies in the fact that they're already physically, as we are already, within Midtown core is that window, right? When you looked at the orange dots and blue dots. So we're respecting that, distinct from physically relocating, shall we say, to a great degree to the north, to the west, outside of the for that matter, outside of the jurisdiction of the City of Toronto. The idea is, the other is least disruptive factor. I think the key touch point, to the extent there were a number of criteria, we didn't really put a weighting on any individual criteria. We weren't that mathematical about it to put weights, but it is to say that the disruptive factor is a key element in this discussion. And so it stands to reason that we looked at where do staff live in relation to the office presently, and the least disruptive, when you think about it, if we were to move, would be arguably across the street. because it's status quo in terms of the commute, when you think about it. So through my way of thinking is, you want to stay within that window, that mapping, and it's all about minimizing disruption, and that includes communications and relationships that pre-existing with other agencies and proximity to those agencies. But the priority number one is our assets are our employees, and in my way of thinking, least disruptive to those employees in terms of where, if we relocate, where we relocate to should be the least disruptive in terms of distance away from current location. I'm not sure if I'm addressing your question, but
Partly.
partially, okay.
Yeah.
Thank you.
I'm not trying to be a politician here and sidestep it, just doing my best to respond directly.
So does it mean that once we relocate, then more staff will go into the office, or?
I think to rephrase, if we were to relocate, as opposed to once we relocate, if we were to relocate, I defer to Dan to respond to the question, what impact that might have in terms of attendance and whether it's a disruptor to the current hybrid model.
I can add to that. Our current environment is such that we don't have a mandate for when staff need to come into the building. That doesn't mean that staff don't come into the building. There's a small core that does, and we also have purpose-driven meetings and events that bring people into the building. So I don't want to leave council with the impression that there's no one there, that it's zero occupancy. And so when we factor that in, and we factor in the work environment and how it's structured, which is really not conducive to certain types of work, when we factor in that we have rental costs for venues to come outside of the building, we could not hold this meeting in the current building. There is not, unless there's major renovations on a particular floor. We're really also anticipating the future. So any decision, and I think Mark raised this earlier, any decision we make will be a decision that really looks out into how we might work. It may be that there's more staff required down the road to come into the building. We don't want to limit ourselves to that possibility. So there's a number of factors. None of these factors by themselves lead to a decision, but it's, I think, FAR's intent to pull them all together that allows you to look at all of the different component parts that Mark has presented that leads to the recommendation in the best judgment of the committee. But from a staff perspective, I think we're trying to anticipate how we might use space differently, how more people might want to come into the building, and how down the road there might be more of a requirement, and how do we accommodate all of that?
Thank you.
Thank you. Erin?
Thank you. I have two questions. My first question has to do with leasing versus buying, which I think we've touched on a little bit. And I know previously we've raised some questions and concerns about leasing. Is this still a discussion that is on the table, or has it been decided that buying something new is not happening, and we're going to lease, and that's what's going to happen if we do sell? So that's my first question. My second question has to do with the motion with number 2. And can you clarify what you mean by formal exploration of the sale? Does this mean that when you come back to us next meeting, that the brokerage is going to list the property and put it on the market, and that you'll be coming back to us with potentially offers, or something else?
Thank you, Erin. So I'll respond to the second question. We anticipate that how this would unfold would be, if you decide today to pass those motions, and in particular the motion involving Colliers to retain with regards to the sale of the property, we would anticipate within a matter of months, not weeks, that Colliers would be presenting us with firm proposals, offers, with respect to the property, which we in turn would review in detail and then would summarize and present to council. Council would not be ever in a position where those, or finds itself that those offers are binding in terms of commitment. Secondly, with regards to Colliers, the contractual arrangements are such that there's no financial obligation, no entitlement contractually in terms of fee for service, where if we default and say we're standing down, we're not proceeding, so we're going to run with status quo, continued occupancy. There's no financial liability arising from that decision, to be clear. Does that answer the second question?
Yeah, so just to clarify, we would be agreeing to list the property, but if we decided not to proceed with the offers that we got from potential buyers, there would be no obligation on council's part.
That is correct. Hence the word exploratory. It's to essentially explore in the sense of to come back to council with hard data, hard information, real offers, tangible dollar values. And Aaron, my apologies. The first question again?
Yes, thank you. The first question had to do with leasing versus buying, and whether the potential for maybe buying another more suitable property is still something that's on the table, or if we are committed to leasing, should we move ahead with the sale of the property?
We have not engaged in discussions aligned with a purchase of a property. The discussions that we've had at FAR and with Colliers have been unilaterally leasing, not possibly purchasing. We have not tabled that nor explored that option.
Dan?
I want to add to that because there has been some exploration of that on the staff side, and Jeff could probably speak to this as well. The preliminary exploration of that is that there are really no properties that would suit the needs that we are expressing at this point in time. In fact, I think some of the limited numbers that were available were fixer-uppers. There was major demolition and renovation work that would be required. So that wasn't brought to the committee only because there really was such a limited or short supply, even as we extended beyond the downtown boundaries. And Jeff can certainly add to that if I've missed something.
Yeah, we did talk to our advisors about this within Toronto proper, not just downtown. There was about 4 properties that would fit the floor plate we're looking for. And like Dan said, there were fixer-uppers or tear-downs. There was nothing really suitable for us at all.
Thank you. Brian?
Thank you very much. First of all, I want to express my sincere appreciation to the FAR committee, the staff, and even the consultants that I believe were excellent thus far in assisting the work to examine what are the best steps to take at this time. Coming in today's meeting, we had some excellent reports from the consultants and certainly from Mark and FAR. But it sets the table for further questions, a number of good comments and questions that have been raised as we look at the recommendations thus far to proceed. I would strongly recommend that we approve the motions, the recommendations that are before us today. That will lead us to have further information and further discussions on this important topic going forward. But I've been very impressed with everything that's gone thus far, and we've come a long ways in a relatively short time, but we want to make sure we take the proper steps going forward. But congratulations and thank you, Mark.
Thank you. Iliad?
Yes, thank you so much for the presentation. I just had a question. Are we getting any estimates for what it would cost to renovate the space? Do we have any proposals? Maybe a designer can think outside the box and present us with a floor plan that works for us? Do we have anything like that, or?
Thank you, Elliot, for the question. Jeff, would you like to respond to that?
Sure. So we did look at this option of renovating back in 2014, and we did start the work, and we did part of a floor, the second floor. The estimate in 2014 was $10 million to renovate the building. Now, if you look at inflation and how much construction has increased since that time, I would think it would be minimum 12. And if you want to do the wrap of the building, that would be another 1.5 to 2 million. So it would be expensive.
Thank you. Anthony Lisho?
Thank you. I have a couple of comments with regard to some of the comments that have been made, whether to purchase another location. I think the times change, and Alan, it's great to have heard about the history, and it's great history. But I think where we are today as a society, I think the times do change, and I personally think the best way to go is to lease and not to own. And second of all, there aren't really any great locations, and if you're lucky to find one, there's a huge cost to renovate it the way we envision it to renovate it going forward in the type of environment that we want to have. Did Colliers have how can I put it nicely? Did they comment on the market as it is today? And is it a good time to put it on the market? And I'll just continue, and then you can answer them. Secondly, and it kind of follows from that, what was the hurry of signing a listing agreement? Honestly, I know that we're not committed, but I mean, listing agreement is a listing agreement, and I know that we have, legal people, and we have accounting and everything else like that, but I can't see why it was necessary to kind of lock yourself in to a listing agreement. And my last point is that, and just this is a comment, let's just keep in mind that as described, Colliers is basically, I don't know if conflicted is the right word, but they're going to be on two sides of the same. In other words, they're going to, in the real estate market, they're going to double dip. They're going to be involved in us finding a new place and negotiating with the landlord for a new place, and they're going to get a fee for that. And obviously, they're going to get a fee from us for selling the place. So those are my comments, and I know they're not, straightforward questions that there's necessarily an answer to them, but I put it out there for everybody to kind of think about it. Thank you.
Thanks, Anthony. What I can do is share my observations as a member of FAR, and I would invite both staff and other members of FAR to weigh in terms of their takeaway from the meetings that we've had with Colliers as part of a FAR committee meeting. The impression that I am left with is that, and I addressed it earlier in our conversation, is that 6 Crescent is a unique footprint, a unique location in relation to other properties currently listed. So that is to say, a property the size of 6 Crescent, let alone the opportunity to be part of a massing with abutting lands that could potentially transact, those lands abutting our property along Yonge Street, is a unique opportunity. is the impression I was left with. And it is very distinct from other properties currently on the market. And further, it's essentially a property by virtue of its uniqueness, location, Rosedale Edge, across from the transit station, no height restrictions, and well, relative speaking, some restrictions, but lots of potential latitude in terms of redevelopment, subject to approvals. It essentially, to some degree, is devoid of what otherwise market conditions that present themselves elsewhere. So it's got to be. They've left us with the impression that there'll be lots of appetite. There currently is lots of appetite, notwithstanding the seesaw of market conditions. I'd like to respond to the second question, and then I'd invite members from FAR to weigh in terms of their impressions left, in terms of the information that was conveyed to FAR by Colliers in relation to the marketability of our property. But Anthony, the second comment about what's the rush, through my lens, there is no, quote, rush. I think we've consumed a lot of energy on this discussion as a group and staff resources over a period of months and years. And in an ideal world, we would bring it to a head and make an informed decision. And if we make a decision today to hit the brakes and go with status quo, to some degree, we've lost the opportunity in terms of closing the circle, in terms of this topic and the decision making. We've also spoken to the do nothing option and why we at FAR felt the do nothing option was not the right decision, not respectful of what we feel is conducive in terms of the work environment for staff. So my way of thinking is, whatever the outcome of the decision, let's as a team work towards closing the circle and making an informed decision with hard data on the table. And to that end, hence the motions that are presented to you, which are non-binding, but they're essentially saying instruction to go out, get that information, and let council then make an informed decision, whatever that decision might be at that point in time. Other members of FAR, Jamie, any comment you'd like to share regarding your takeaway from Colliers in terms of our property?
No, you've done an excellent job in pointing out the uniqueness of the property. And I think we're not talking about a listing agreement here. We're talking about gathering data. And a good governance is all about data-driven decisions. So, what could be wrong with gathering more data, especially for a key property like this, which I'm pretty sure won't be going down in value over that period of time, especially in that location. But I think council will have much better information the further we go down the line, recognizing that there is no commitment to sell, to lease as yet without the appropriate amount of data that we all feel comfortable with.
Thank you, Jamie. Any other members of FAR would like to comment? Anthony?
I have a supplement question or comment. We've all heard and we know that that is a prime location. And definitely, whatever we do, it will get rezoned. And makes sense that they rezone right to Yonge Street. It doesn't make sense that they're going to rezone just on our little postage stamp. What about the consideration of we continue to go along this route, but somehow keep in mind, and since Colliers is going to be involved, perhaps he may be even involved with the zoning, is consider that we go out there and lease something for a period, 5, 10 years, and or, depending on the time, when this is built, somehow if we could go into that structure, because it'll probably be residential with retail on the ground floor. And so we may, because there's nothing better location-wise in terms of our staff and for us to be able to reach that particular spot than if we're going to end up at Yonge and Eglinton or somewhere else in the city. I mean, the location is absolutely immensely appealing. So I just, food for thought.
Thank you, Anthony, for sharing that thought.
Harinder, did you want to speak? Okay. Okay, thank you. Next on my list is Rod.
Hello, Rod.
Hi, can you hear me? Hi, Mark, how you doing? I was on the previous FAR committee that sort of got this whole thing going 5 years ago. And at the time, the balance sheet just screamed that we were missing a huge opportunity cost if we didn't do this assessment. And I'd just like to thank you and your team for all you've done to put some meat on the bones on that analysis that we raised so many years ago. And it's borne true to what we expected back then. In response to Judy, I can understand her comfort with bricks and mortar, but corporately and personally, we all go through downsizing in life, and this is probably one of those occasions where we are. We have a building that is, I'm not just going to say dysfunctional, but misfunctional, that is highly underutilized, and an opportunity cost that is not benefiting us at the moment. And to some extent, you could, if you were the public or the membership, make the case that we would be responsible if we didn't consider this. In fact, and that was sort of my approach financially. This is in our due diligence process, and right that we do so to right size. In response to Nalen's comments about worrying about other third parties that may have a stake in our financial wherewithal, my only response is that today we have that asset, and the ODA and other third-party organizations have their assets, and there's no claim on that asset. In fact, and as you rightly point out, Mark, this still becomes an asset that will be put towards the strategic and operational requirements of us. So I don't think there should be a concern in that way at all. Thank you.
Thank you. Osama.
I just want to make a couple of points. So first, I love the presentation.
Thank you.
Very good. The decision tree was very clear as well, and it makes a lot of sense. And I'm very much in favor with the exploration of and getting more information on this and doing a deeper dive. The way I see this going is actually what Anthony just touched on, is we may be happy with a lease option, but we may not be very happy with a potential offer on the table. And this may happen, right? Like, this is a prediction. We may be happy with the lease option and not happy with what offer we're going to get on the table with the purchase. Because it's such a unique property, things kind of have to align a little bit in the setup of this. So we may want to consider, and this is for the FAR committees, where there may be a decision to be made. And the reason why I bring it up now, and it will probably bring it up later again, is this needs to be put in the back of our heads a little bit, because we may want to pick a lease option and actually set up the proper circumstances for the staff and do a lease while we do a risk assessment in terms of where what our return on investment will be with the sell itself. And we may very well be in that situation in the next 6 months.
Thanks, Osama, for the kind comments and for the thoughts. And you're absolutely correct. We will know when we get the data. And we will, and what you potentially foreshadow may come to reality or may not. But either way, all the more reason why both situations must, if through our lens, must unfold concurrently. That is to say, not staggered, where we commission Colliers to go and check out new digs and new options and present those to council, but hold back on listing, but rather do them concurrently, if not only to make, because to some degree there may be a crossover in terms of the decision making, in terms of arguably occupancy, continued occupancy, while the leasehold is being prepared at the new location, negotiating into the sale transaction the right to remain with a 90 days notice, maybe carried interest as far as occupancy, rent, pay utilities, no rent, et cetera, no property tax. Who knows what's available to negotiate, but there's more arguments in favor of doing these two concurrently, and again, presenting council with an informed decision, whatever that decision in the future might hold, and whether it entails one or the other or both. Thank you. I have a comment, but I'd like the opportunity for council to continue with questions, but I'd like to circle back to Nalan's comment about the potential and questions that might arise and comments from the professional members of the college. But are there any other questions from members of council?
I still have 3 people on my speakers list, so Dan Fortino, you're next.
Hi, Mark. Excellent presentation, great analysis. I'm curious, was there any exploration of vacant property within the GTA or surrounding areas, and considering working with a builder to do an actual new build and sell the existing Six Crescent property, and how that would look like? Also exploring some of the negatives of leasing, I think haven't really been touched on, because there could be some downsides to having a landlord and picking the most appropriate landlord to suit our needs. Asset retention is important, as Judy mentioned and a few people mentioned. I think cash versus property asset are 2 different types of assets, and there's pros and cons to both. So I think that definitely should be evaluated and explored. So there's kind of 2 questions there. I'm just wondering if that has been discussed or brought up, kind of building something from scratch or working with different builders that have up-and-coming projects.
Thank you, Daniel. It hasn't formally been tabled in relation to FAR committee. Having said that, though, I know staff have done some work independently, and maybe Jeff, would you like to respond to whether there's any work that's been done along those lines? You shared with us that staff had looked at a couple of options in terms of purchase, but had staff looked at vacant property, if I understand what you're saying, Daniel, and new build on vacant tract of land?
Yeah, so we have not looked into that. I'm not sure where there's vacant land in Toronto where we could build. So we did look at like properties that would fit our needs potentially in terms of floor plate, but there was nothing available. So I think one thing, you could go outside Toronto and you'll have no staff coming in. So we have to be on the subway line. I think that is absolutely critical if we're going to entice staff to come into the building. So the outlying areas, we haven't touched on that at all.
Thank you. I've got 2 people on my speakers list, and then we'll start going to introducing the motions. Deborah?
Thank you.
Hi, Deborah.
I just wanted to say excellent presentation, as everyone's been mentioning. And one is a comment, and the other one is just a question. First, I want to applaud FAR for being able to have Colliers come on board and provide us with all this information, both on the sale of the existing building and the potential leasing of another one at no cost, because I've never heard of anything like that. So thank you for that. The other second comment is, would it be possible to provide the council with the college office criteria that you're looking for, so that to improve the working environment for the staff, so we know when we do have something potential lease potential, that it checks all the criteria that we're looking for? That's possible. Next meeting is fine.
Yep, absolutely. Thank you so much for the kind comments, Deborah, and duly noted. I know Michelle, this would, in my view, fall in Michelle's zone. So would you like to provide a commentary regarding criteria?
Yeah, sure. Thank you so much. So there's a 9 criteria that you have seen in your briefing note already related to what we are looking for in a new space to meet some of those objectives, including environmental sustainability, being a magnet for staff, so being attractive and being able to retain staff, and you know those 9 criteria. In January, we updated a playbook with Colliers, as been described already, and that playbook really speaks to workplace models that we're seeing across many sectors. So, reducing the sizes of office, densifying workspaces, having areas to collaborate, private areas, places to have hybrid meetings and conversations. So, yeah, Deborah, we can definitely give you, a sampling of what Colliers suggested. Right now, it's theoretical. We don't have an actual designer because we're not pursuing a space in this moment. But there's lots of theoretical concepts about what our new space could look like because the way we work has changed. And there's really good reason when we come together. And right now, our space does not accommodate when we do come together. And so we want to make that meaningful for staff and make sure that we have appropriate space for the type of work that we do. I hope that answers your question, Deborah, but I can take any other if you need.
Yes, it does. Thank you, Michelle.
No problem.
Thank you. Stephen.
Thanks, Michelle.
Thank you. I agree that more data needs to be collected, and I'm fully in support of that. I'm wondering if you've explored that if this property is ripe for development and a developer comes in and maybe tears the building down or whatever, have you thought about leasing from that developer, maybe with some customization that they would sort of build to your requirements, which would enable staff to continue to work from the same general geographical location? And you might be able to leverage that kind of renovation to your criteria to give you some advantages. So just a thought about whether you've explored that or not.
Thank you, Stephen. Good suggestion. The direct answer is we haven't explored it, but having said that, we are anticipating that the offers forthcoming will be very creative. We are anticipating, given the nature of the property, that distinct from a bid war, that the value-added proposals that we will receive, value-added being in addition to cash for keys, we will witness inducements, the likes of which, one of which you're suggesting, creative thoughts. So we're not going to be soliciting necessarily, but we are anticipating, and perhaps we will, upon further reflection, table those suggestions. But having said that, we're anticipating that this is not going to be just a cookie-cut black and white exercise. Thank you for your suggestion.
Thank you. My speakers list was over. I saw Anthony's hand. Okay. Yes, Mark.
A closing comment, Mr. Chair, if I may. I'm, as chair of FAR, and I think I speak on behalf of other members of FAR, who I'd like to acknowledge and thank for their hard work in participating in today's presentation. I'd also like to acknowledge and thank staff, and in particular the communications team led by Leslie Byrne for helping us with the presentation materials today. Thank you kindly. As chair of FAR, I look at this primarily through a lens of good governance. I try to step back in terms of preference and personal view. I want to reassure council I've been trying steadfast to look at this through a lens of good governance. Ironically, when we chatted about reserves earlier and the need to have a reserve policy in place, if not initiated by virtue of the outcome of PLP, let alone potential real estate transaction. When I joined council, and arguably when I joined FAR, we didn't have a reserve in place, operating reserve, to my recollection. We've worked hard at implementing an operating reserve. It's a measure of good governance, and arguably it's a mandatory requirement of CPMF. CPMF goes further to say a minimum dollar value of that reserve must be 25% of your annual operating costs. We worked hard as a team. This council worked hard as a team with staff, with FAR, to up our game, put in place a operating reserve, and to fund it to the, at present time, minimum requirement. That amounts to about $7.5 million sitting in an operating reserve. That's the minimum. There are agencies that have operating reserves that are funded to the tune of 100%, 1 year operating cost. Our annual operating ballpark, Jeff, correct me if I'm wrong, is in the order of 21 million? Yeah, okay, 31, thank you. 31 million, we're sitting at, arguably, that's correct, 25%, 7.5 million. When I think of the proceeds, yes, it's an asset, it's a financial asset as opposed to bricks and mortar. But when I look at good governance and I factor it in, I think to myself, and the need to be judicious and responsible in terms of the management of the proceeds, to maintain the not-for-profit, I immediately focus on our operating reserves. And the irony of the discussion is that if you were to top up to get 100% of it, to fund your operating reserve, 100% fulfillment of CPMF, that accounts to, according to my math, what, 25 million. Well, isn't that ironic when we look at the potential proceeds? I'm not suggesting that's the number in question, but I am saying that we wouldn't even be funding 100% of the operating reserve, but we would be certainly diligent and demonstrate good governance in terms of the management of those funds, in terms of what to do with this and how to navigate. So I leave all of those thoughts with you today, and I hand the chair back to you, Hanno, for the motions.
Thank you. So, Council, for your consideration, the FAR Committee has recommended 3 motions. We will consider them individually and in order. If I could have motion number 5 on the screen, please. That Council approves Colliers Macaulay Nichols Incorporated as the college's real estate broker of record to conduct a leasing inquiry process. The engagement shall not obligate the college to enter into a lease or incur any fees or commitments. And that is moved by Anthony Lisho, seconded by Deborah. And I'm going to turn it over to Dan, who will do a roll call.
Okay, Patrick Ballantyne.
In favor.
Nalan Bargava.
In favor?
Stephen Bird.
In favor.
Ram Chopra.
In favor?
Jamie Colliver.
In favor.
Peter Delane.
In favor?
Daniel Fortino.
In favor?
Neil Gajar. Has Neil left us?
The screen's frozen, just looking at the Zoom
I'll come
screen.
back to him then. Noha Goma.
In favor?
Daniel Haas.
In favor?
Iliad Horner-Parver.
In favor.
Vivian Hu.
In favor.
Anthony Liscio.
In favor?
Anthony Mayer.
In favor.
Harinder Sandhu.
In favor.
Adele Simeon.
In favor.
Brian Smith.
In favor.
Osama Solomon.
In favor.
Robin Somerville.
In favor.
Rod Stapleforth.
In favor.
Mark Trudell.
In favor.
Aaron Walker.
In favor.
Judy Welikovich.
In favor?
Deborah Wilson.
In favor.
And Neil Gajar. Okay. I believe the motion carries.
Yes. So
And Neil's having trouble.
23 in favors of the 23 who voted. Thank you for that. So virtual hands down again, please. If I could have motion number 6 on the screen. For your consideration, Council. That Council directs staff to proceed with the formal exploration of the sale of 6 Crescent Road in the City of Toronto. And that's moved by Mark, seconded by Deborah. And again, I'm going to turn it over to Dan to do the roll call.
Okay. Patrick Ballantyne.
In favor.
Nalan Bargava.
In favor?
Stephen Bird.
In favor.
Ram Chopra.
In favor?
Jamie Colliver.
In favor.
Peter Delane.
In favor?
Daniel Fortino.
In favor?
Neil Gajar.
In favor, and the previous one as well. My apologies.
Thank you very much, Neil. Noha Goma.
In favor?
Daniel Haas.
In favor.
Iliad Horner-Parver.
In favor.
Vivian Hu.
In favor.
Anthony Licio.
In favor?
Anthony Mayer.
In favor.
Harinder Sandhu. In favor. Adele Simeon.
In favor.
Brian Smith.
In favor?
Osama Solomon.
In favor.
Robin Somerville.
In favor?
Rod Stapleforth.
In favor.
Mark Trudell.
In favor.
Aaron Walker.
Oppose?
Judy Welikovich.
In favor?
And Deborah Wilson.
In favor?
Thank you. That motion passed, 23 in favor, 1 opposed. And in this matter, Council, for your last consideration is motion number 7. If I could have that on the screen, please. That Council approves Colliers, Macaulay, and Nichols Incorporated as the college's real estate broker of record for the potential sale of the property municipally known as 6 Crescent Road, Toronto, Ontario. The engagement shall involve no fees payable unless and until a sale is approved and completed. And that's moved by Brian, seconded by Anthony Licio. And I'm going to turn it over to Dan again.
Okay, one more time, Council. Patrick Ballantyne.
In favor?
Nalan Bargava.
In favor?
Stephen Bird.
In favor?
Ram Chopra.
In favor?
Jamie Colliver.
In favor?
Peter Delane.
In favor?
Daniel Fortino.
In favor?
Neil Gajar.
In favor.
Noha Goma.
In favor?
Daniel Haas.
In favor.
Iliad Horner-Parver.
In favor.
Vivian Hu.
In favor.
Anthony Licio.
In favor?
Anthony Mayer.
In favor.
Harinder Sandhu. Adele Simeon.
In favor.
Brian Smith.
In favor?
Osama Solomon.
In favor.
Robin Somerville.
Opposed?
Rod Stapleforth.
In favor.
Mark Trudell.
In favor.
Aaron Walker.
In favor?
Judy Welikovich.
In favor?
And Deborah Wilson.
In favor?
Thank you.
That motion also passed, 23 in favor, 1 opposed. Thank you. Thank you, Mark, to you and your group. Thank you, Council, for your considered comments and questions. We went significantly longer on this matter than we had anticipated, but I think it was really important to do so. We don't have a lot to do, but there is still some business. So what I'm going to suggest is that we do a 10-minute break right now. And if we can come back after 10 minutes, we can address the rest of the agenda and still get people out as close to 3:30 as possible. So if we can do a 10-minute break and be back here at 2:55, we will continue then with the rest of the agenda. Thank you. 2:45. Thank you. Thank you and welcome back, members of council. Item number 11 on the agenda deals with strategic planning. Today we are going to receive the final report to council on the 6 projects under the 2023 to 2025 strategic plan. Throughout the duration of the strategic plan, council has been kept apprised of the college's progress on these projects through regular status reports and dashboards. The material can be found from pages 172 to 196 in your package. Andrea Foti, Deputy Registrar, will walk you through the final presentation. So Andrea, I'm turning it over to you, please.
Yes, thank you, Hanno. Good afternoon, everyone. You've got in your package, as Hanno said, our final report from the 2023-25 strategic plan. What I'm going to do today in my slides is a little bit different. I'm not going to go through that report in its entirety. You can read that. We've captured for each project in the written report a summary of our activities over 2025. What I wanted to do in a little bit of time today is just talk you through and do some reflections on the plan in its entirety. What have we accomplished over 3 years? So I'll just get Angela to move to the next slide if you don't mind. So this is, again, just a reminder of, in 2022, Council approved the strategic plan that we just closed. And it was, again, just this idea of how do we set a course that's meaningful? What work do we set our sights on? What impact do we want to have? If we just move to the next slide, Angelo. You've seen this many, many times. The front and back covers of our strategic plan, where we were anchored to 3 key pillars: professionalism, stakeholder engagement, and emerging issues. And if we go ahead, Angelo. We really, as I said, we launched that in January of 2023, and it closed around December 2025, though some work continued into January. And in between those 2 points, we came to you quarterly with written reports, with a dashboard, and you were able to see sort of how those projects proceeded, what impact we were having. Additionally, depending on the nature of the work, you had dedicated briefing notes on items coming out of strategic projects that you looked at. So a good example would be standards. So we move ahead, Angelo. So over the past 3 years, there's really been an enormous amount of impact. We had a chance at the staff level to do a couple of sessions, both with our project managers and with our broader staff group, to really reflect on how far we've come. You know, some of the work that we've done has been foundation setting. You'll hear me talk about that in a moment, especially in our standards work, for example. Some has been really continuing our culture, building out our intention to commit to a continuous quality improvement mindset, a culture of collaboration, of curiosity. We've made advancements in technology and digitization, service experience, user experience, a lot of partnership work, our regulatory programs, work that you see a snapshot of reflected on our corporate dashboard that Dan talked about today. Work in those programs to really think about how do we take a risk-based approach, how do we embed that and have that drive the work we're doing. So lots and lots and lots. These are just tiny observations. If we move ahead, I'll just remind you, these have been the 6 strategic projects we've had over the last 3 years. And in the next couple of slides, I'm just going to touch on each project and give you some highlights. I can't really, I mean, it's been a lot of work over 3 years' time. You've seen much of that. But I'll just pick out some highlights of what we've been able to accomplish. So if we start with college standards, and for each project, I'm just going to very purposely and intentionally acknowledge our project manager, the sort of leader behind all of this work. So for college standards, it's been Cameron Thompson. Cameron has been supported by our policy team. I would say over the past 3 years, the story of this project has been kind of in 2 parts. The first part, captured on this slide, has been building out some really important foundational infrastructure. You know, 3 years ago, we didn't have a dedicated policy team. We set about to recruit that and onboard them. You hear about their work often. They're a busy group, along with many of our other staff groups. The team, under Cameron's direction, has created a standards review and development process and launched that. We've had consistent consultation and engagement. Cameron and team have developed a risk-based standards prioritization framework, that has really allowed us to determine how do we know what standards to review on what pace. There's a lot that we need to get to. There's new standards we need to develop. How do we tackle it? So the team took a risk-based approach and under the guidance of the Quality Assurance Committee decided which standards we move ahead on. In addition, website enhancements to really ensure we can share detailed information, accurate information of the work we're doing. And we, of course, many of you are on it, we have our Standing Policy Working Group, a new model to give us some guidance into that work. If we move to the next slide, this is just a brief capture of the actual standards development and review work we've been able to accomplish. And you can see here, lots and lots of work has happened. 5 finalized standards, we've rescinded the COVID guidance, and we have 4 more in progress. And then that doesn't count all of the many knowledge translation resources that the team have been working on, the ways in which the team, along with other staff groups, have been supporting our CDSO Connect events. So lots there. If we move to the next, this is access to care. We have Michelle Cabrera-Gali as our lead. And again, I've kind of split this into two components. You've heard today and in previous meetings about the standards-focused work, and we'll get to that in the next slide. But for this slide, there's been a lot of work in partnership with other areas to build out resources for patients. How do we get information about low-cost, accessible clinics in the hands of patients? We've got a dedicated webpage. With the support of our communications team, we have a search function where a patient could enter in what they're searching for, and it'll actually form like a Google Map approach where they can get information about the closest low-cost clinic for them. On that page, we also highlight volunteer opportunities for dentists and information about government-sponsored programs, so patients can really help navigate and wayfind if they do need some assistance in financially accessing care. We've also had really exciting and important collaborations between Michelle and Susan Taylor from our quality department and Michelle Tremblay, who heads up our EDI work, to think about how we can expand our CE offerings to really highlight different patient populations who may have unique needs and assist dentists in building inclusive practices. And we've done, you can see here on the slide, we've partnered to date with a number of organizations who are approved sponsors for CE programs. I would add to this, we've also taken some steps to approve different types of CE activities. So opportunities for mentorship, opportunities to coach, and so forth. And so it's really been an exciting and interesting part of this project. If we move to the next slide, you've heard about this work, but this is, of course, the work of our professionalism working group, and we have many members of that group around the table today. This work has been assisted by Dr. Bonnie Yu, who is a staff dentist. She's been our clinical advisor in this work and has a lot of expertise related to public health dentistry and access to care. And this group has formed Foundations of Professionalism, which was approved last year, along with some companion documents. And then, of course, the draft Managing New Patient Requests document that was just approved by you today for consultation. Lots and lots of work, lots of diligent focus on research and analysis and options that have really gone into both documents. If we move ahead to the next group, service experience. This has been headed up by Michelle Tremblay. What you've got on this screen has really been a dedicated focus to expand our active offer of French language services and our translation offerings. So under Michelle's leadership and with the support of many staff, including Nicole Bay and a number of committees, I will name them at the end just for brevity, but you can see here we have a number of staff who are specifically recruiting who can offer services in French and speak to people who prefer to work in that language. We've set about to translate a number of college documents into French. We've got a contract with an interesting vendor, MCIS, who provides for us on-demand translation into multiple languages. So when needs arise, we can really go forward and have that met. And we have our French committee that was formed. You know, all of this is sort of work that was brand new over this strategic plan. So we've really made some nice progress there. If we go to the next slide. That's not the only thing Michelle's done under this project. You heard a little bit about, in the last presentation, our Thriving in a Flexible Work Culture document. Michelle has headed up that document together with Joe Donahue from our HR department and has held staff focus groups. And you can see here, I mean, she's worked on user experience, really understanding how people experience our website and our staff and access us. We've formed a service panel of our frontline staff to give advice on what our service is like. lots of training opportunities, optimizing data and tech to really be seamless. If we move to the next slide, again, Michelle Tremblay. You know Michelle has been working on our equity, diversity, and inclusion strategic project. Some really important advancements here that are on the slide. We have a committee, what we refer to as IDEA, and that committee was formed over the last strategic plan. They have done a number of different things, including reviewing over 20 HR policies and giving advice as to how they could be made more inclusive. We have an EDI webpage that was developed and launched. We have an AOTA committee focused on accessibility, who's developed a multi-year accessibility plan, and an EDI commitment statement. If we move to the next slide, a ton of work that's happened here. It's easy to list these off, but there's so much that goes into this. So Michelle co-led the first HPRO EDI Network Conference. Again, HPRO is a sort of umbrella group that captures representatives of all the regulated colleges under the RHPA. So that was the first conference of its kind. She's partnered with many others to offer a series of training on a range of topics that you can see here on the screen, all under the umbrella of EDI. She's led and supported the development of vodcast training model for our governance committee in terms of candidate selection, and then an anti-bias committee support document. So again, none of these existed prior to the 3-year period I'm talking about, so lots of work has gone on. If we move ahead, governance review and modernization. This is led by Laura Thacker. There's a lot here. I mean, I think, you know, you've heard over a number of meetings, including today, from members of our governance committee. That committee didn't exist prior to this strategic plan. So that committee was formed and populated. In terms of reference, they've been hard at work. We've launched council performance evaluation frameworks and different tactics there. Lots of bylaw amendments, training, orientation, and the analysis of some demographic data from our council and committee members. If we move ahead, also, and you'll recall this from just, I think, a meeting or two ago, a really comprehensive modernization framework around elections and terms. So a province-wide election, trying to get to a greater sense of parity in terms of professional and public members, staggered terms, and eligibility for academic council members. So again, you know, a lot of work has gone into this in some new areas that we haven't worked on before. And if we move ahead, this will be our last strategic project, practice models in corporate dentistry. And this has been under the leadership of Denny Ogarindi in our policy area. And she's been supported by Dr. Vicky Nguyen, who's provided clinical advisory support. You'll recall, this is an area where Denny really dug in and did some foundational desktop research to get an understanding of what do we mean by practice models and corporate dentistry? What existing regulatory tools do we have to address issues? What are the concerns? What are the opportunities? Part of that work, Denny really set about to understand how are dentists practicing? What are the different models that they're using? And she's defined those and identified them and did a council education session. And then if we move to the next slide, she's then in turn generated a really comprehensive report that's come to council with some explicit options identified that we can move forward on. And we are going to move forward with your direction, which we got from you last year, to proceed with all of those options. So we're in the process of thinking about what implementation looks like. How do we stagger that? And both reports, there's the comprehensive report, which is on the left-hand side of the screen, and a summary report are on our website. And again, this is an area where, although we've been talking about it, this college hadn't done a lot of dedicated work, if at all, in this area before this strategic plan. So this is a big step forward. More work to be done, but a big step forward. And so if we move ahead, as you can see woven throughout this, a lot of work has been accomplished. This is really down to an incredibly dedicated team and support system. And I just want to call out the the box, sort of the black box on the upper right, is all of our project managers. I want to especially acknowledge Eric DeSaw and Cameron Thompson. Eric, you've met before. Eric is our data scientist, but Eric and Cameron have really taken the lead on implementing our strategic plan, supporting our project managers, and keep things running smoothly. Eric DeSaw and Helen Q are in our data area, and they are the brain power behind pulling together the dashboards that you get for the strategic plan and the operational dashboard. And last but certainly not least, I won't read them out, but the last box in purple are all our incredibly dedicated staff and committees and groups who have supported the work under the strategic plan. It's truly been a team effort, lots of collaboration, and idea generation. So. And then, of course, lastly, but certainly not least, if we just move ahead, Angelo, a special thanks to council. You know, you've given us great direction all along. You've given us feedback as we've come to you with these projects and at different stages of work. And, you know, we've worked hard and diligently to implement all of your direction. And hopefully, as you're hearing about these accomplishments, hopefully you're feeling good about the work we've done. There's more to do, and we'll do that under the next strategic plan. But that's it. I'm happy to take questions if you have them.
Thank you so much, Andrea. We do have a few minutes, Council, if you have questions or comments you'd like to make. Harinder?
Thank you, Hannah. The entire staff. Can't hear? I want to congratulate you and commend you and your team, all the staff, for amazing work you have done and accomplishing what you did. Not only that you have done all this work to complete, there was PLP divestment was thrown into it. College standard work was not part of our original strategic plan, and that is a big undertaking Cameron and his team has come through. Thank you so much. We really greatly appreciate.
Thanks, Roger.
Thank you, Harinder. Judy?
Yes, thank you. Can't sit down yet, Andrea.
No problem.
Yeah, I would echo Harinder's comments. I think there's been a great amount of work done, and I really congratulate you on that. It's kind of exciting at the council level to be part of it. My only comment relates to access to care, because I noticed on the dashboard that all of the planned activities for this period have been completed. And what I'm not seeing is any information about impact. And the other thing I'm not seeing is a great amount of concrete steps taken to enhance access to care. There's a lot of education, there's a lot of collaboration, there's a lot of talking, but I don't see a lot of steps. And as I said to you earlier, you know, one of the things that we were talking about a few years ago was CE credits for community work by dentists. That increases the amount of dentistry that's available, and increasing the amount of dentistry increases access. So I'm just wondering if you know, if you're looking for any kinds of input in terms of direction for the coming period, I would like to see that kind of information. I'd like to see some concrete steps taken, and then a reporting back on the impact. And maybe there has been impact already, but that's not reported here. So, as I said, you know, it's a great report otherwise, but I think access to care is something that really needs to be done. It's like I know it's like trying to correct for inadequate housing. Probably not going to be settled in my lifetime, but still, those are my comments.
Yeah, thank you so much. And maybe just a brief response. completely understand where you're coming from, Judy, and I think that certainly the community aspect that you were talking about, and I know we talked over lunch about it too, we do have the ability to give CE points, and we have been giving CE points for people who want to mentor or coach individuals to make their practices more inclusive. So those have come through. That was approved by the Quality Assurance Committee in 2024. Doesn't mean that we can't do more or we can't think of what else we could do. We also have had a number of our RCDSO Connect sessions focused on different patient populations to really assist dentists in responding to the needs of communities and assisting with access. Again, nothing is going to be a singular solution. Your comments about data and impact are really interesting, and I think for the next strategic plan, we've been thinking about ways we might be able to do the dashboard a bit differently, and that's still in process, and we're still working at it. We have been thinking a lot about data and analytics and what are the opportunities where we could show or try to understand impact. Not easy, but we're going to continue to look at that, and we can have those conversations. Simply because the elements of this strategic project are complete doesn't mean all of the issues related to access are complete, and so we understand that very well, and we can certainly continue and at this table have a conversation about what our work looks like going forward.
Thank you.
Yeah.
Thank you, and thanks again, Andrea. Next item on the agenda, Council, is item number 12, is a presentation on the Communications Department of the College. Over the years, you have heard from other departments, including policy, registration, and FIP. These presentations are designed to allow Council to better understand the internal workings of the college. Today, Leslie Byrne, Director Communications, will walk you through a presentation. So I'm going to turn it over to you now, please, Leslie.
Thank you so much, Hanno. Can you all hear me? No.
Yes, we can.
Okay. Apparently that can be heard. Closer to me? Okay. Big part of communications is being heard. Good afternoon, everyone, and thank you so much for giving me some time to present today. This presentation is about the Communications Department. Some of you who've been here a little bit longer have seen other departmental presentations. But communications is really broadly about how we help the college connect, how we explain and we build trust with the profession, with the public, and with our system partners. For some of you, this will be very familiar because you've heard from me before and you know what we do. And for others, this might be the first time you're seeing the full scope of our department's work. So my goal today is to give you a clear picture of who we are, what we do, and why it matters. So what I'll cover today, next slide, please. I'll walk you through 4 things: who we are, what we'll do, how we reach the public, how we reach dentists and system partners, and what's coming next. I'll keep this very high level. It is a little bit of a laundry list, and I'm very happy to take your questions at the end. Next slide, please. As Dan said in his report, in his written report to Council, this is a professional and expert department, so thank you. But communications at the college is more than just messaging. It's really an advisory function. In fact, we have 2 teams in the department. There's a strictly communications team, and then there's a practice advisory service. Together, we translate complex regulatory expectations into information that people can understand and can use. A lot of what we do is preventative, helping dentists get it right before issues arise, and helping the public understand what they should expect from safe and professional care. Who do we talk to? So really, this is just to give you a sense of the range of audiences we serve. It certainly isn't everyone. But the most important audiences, of course, are the public and patients, and then the over 12,000 registered dentists. But as you see, there's many others who pay attention to our work: the ministry, other regulators, educators, media, law enforcement, council, and of course, college staff and our colleagues. Each of these audiences needs different information and a different tone at a different level of detail. Throughout that, though, we need to be consistent. So our job as a team is to make sure that the right message reaches the right audience at the right time using the right media. Next slide. I always talk about the tools that we use to reach people, and as a communicator, I'm really agnostic about the tools. Like, it doesn't matter how you like to receive information. We're going to try to get it to you in as many ways as possible. The website is really our foundation, as it is for most organizations. It's the primary resource for the public and the profession. Internally, too, it's what our practice advisory service uses every single day to pull up information about the college. We use presentations, both live and virtual, for education and communication. As you know, we're broadcasting right now, and our history of council is available on YouTube. We create publications for deeper context, and we use social media to highlight news, and we use sometimes even targeted old school print media. We also use our portal, which is available just to the profession when it's appropriate. And we run our intranet site, which is for staff to keep up to speed with what's happening at the college. For example, tomorrow there'll be a little council debrief for staff. So we think of these as different tools in the same toolbox. Each have a different purpose, but we use them all and all the time. One of those tools, next slide please, is the RCDSO Connect magazine. It's one of our key engagement vehicles, and we write articles and our system partners write articles in it. It comes out 4 times a year, and we send out a roundup email with news in between those issues. The magazine connects dentists to what matters in regulation, practice, and professionalism. It's a way of highlighting recent developments and inviting the profession to go deeper as they see fit. We have good statistics. The most recent issue of the magazine, we had 552 total reads and an average read time of 8 minutes and 38 seconds. So you may know in this fast-paced social media world that 8 minutes is a really long time to keep people's attention. There are American benchmarks for reading professional newsletters, and our overall statistics are strong. 8 minutes shows meaningful engagement and not just skimming. So this vehicle has become an important way for us to build a deeper understanding and trust. Next slide, please. You've heard a little bit about RCDSO Connect. It's a truly cross-departmental effort. So far in 2026, we've delivered 4 virtual sessions with contributions from multiple departments. You've heard from Dan and Harinder about our live session in Ottawa, and it was a co-production with people from the Quality Department, Policy, PCRA, and Communications. This year alone, we've had 6,000 attendees. And that's a significant portion of the profession engaging directly with regulatory content. Over 10,000 CE points have been acquired, and 1,800 participants have come to more than one session. These sessions allow conversation, not just one-way communication, so people can submit questions in advance, and they can also submit questions live. I should add, too, that we've developed a new section on our website, Professional Practice Resource. It's a place where we've gathered all the tools to make lifelong learning easier for dentists. And this section features RCDSO Connect sessions, courses, and resources, as well as learning in action toolkits, those practical checklists that come out of our RCDSO Connect sessions. Next slide, please. We evaluate every session by surveying the participants, and the feedback's been extremely encouraging. Almost everyone plans to attend again, and most, excuse me, report a stronger understanding after attending, and that their questions were answered, which is great. Continuing education matters, and I think Dan referred to this last night. But many attendees say they come back because the information itself is valuable. You know, I talk about using the different tools in the media, different tools in order to reach people. And this one has proven just so effective because it gives people an hour where they can pay attention and really get some great content about standards, about access to care, and a slew of different topics. Next slide, please. This is a snapshot of the comments. I don't need the points, I need this information. So that really tells us that we are getting something right. Useful, practical, respectful of dentist time and experience. Next slide. RCDSO Connect in Ottawa, you've heard about this a few times today. It was really the third time that we had taken the Foundations of Professionalism deep dive on the road, and we've done it twice virtually, and this time in Ottawa was in person. And it was just a great opportunity to really engage in the content in a very meaningful way, where the presenters dug deep into their experience in grappling with ethical dilemmas, and then there was a tabletop exercise for the participants to do so too. I'll change gears a little bit now. Next slide, please. I spoke at the beginning about the website being our foundational tool. We've invested a lot of effort in improving the website experience, and this, just to highlight some of our recent work, we've added an experience survey to the site to help focus the improvements that we do. We learned that search was critical, so we spent time improving it. Over half of users now rely on search as their main navigation, which tells us that people are coming with specific questions, and we want to be able to answer those. The results are strong. We've had more visits, more engagement, and more effective use of search. Longer session times and more interactions suggest that people are finding what they need, and that's very good. This work is never over. It's absolutely always on. As communicators, we have to keep our website up to date, highly functional, and highly effective for all who use it. Next slide, please. Standards are on our website. Standards are a subject of RCDSO Connect events. Standards were a topic here today, both in Andrea's presentation and in Aaron's presentation on the new draft standard. Communicating around standards is always on. We'll communicate after this meeting about the consultation approved today, for example, and that is just one part of an extensive plan to help the profession and system partners understand new draft guidance and understand how they can participate in consultations. Our practice advisors support the policy work, as you've heard, in the development of the materials that will be implementable for other clinicians. They help to develop FAQs, case studies, and articles. The communications supports the policy work through planning, design, outreach, connect sessions, social media. So for standards, we really use all the tools in the toolbox. Next slide, please. Andrea spoke about this under our previous strategic plan, and again, this is work that is always on. We provide service in French as a legislated and practical priority. 2 of the practice advisors on the communications team offer French service to callers and to those who write to us in French. The website has a French toggle, and some of the public-facing materials are available in multiple languages. As you probably know, if you do speak French, a toggled site has its weaknesses, and it isn't perfect French, and we do want our standards to be in excellent French. So we are working through a process of translating those into French, our newsletter as well, and they have to be accurate, and they're reviewed by French speakers in-house and, one of our French-speaking dentists. So we'll continue to expand that. That is work that doesn't end. Next slide, please. I do want to talk for a moment about work that some of the dentists on council may be familiar with, but public members may not. We work with police services and coroner's offices on a regular basis, and we send out requests for information. In fact, one went out during this council meeting. It's very meaningful work. Essentially, we get requests from police services and from coroner's offices across the province to help in the identification of missing people. When we get a request, we send an email to registrants, and they in turn search for records when it's geographically appropriate. It helps families find closure, and it's a really important public service. So last year, we began to cluster requests for assistance. It's helped with email traffic for dentists and their offices, which are very busy. And more importantly, it's allowed us to support more requests. We had 181 last year. Next slide, please. We are also available for comment, excuse me. Well, content in the comment. Dan referred to the media requests that we've had quite a number of this year so far. This is a little snapshot of them. We work to ensure accurate and responsible reporting on sensitive and high-profile issues. We don't get a significant number of requests. Most media inquiries are about dentists who are or who have been subject to an investigation, either by us or by public health or by police. When we get a request in, I usually work with the registrar, the deputy registrar, and the director of PCRA on responses. I don't do them alone. We also monitor media daily, both through a clipping service and social media listening. So we're always keeping an eye on the context of media and the context of stories in which the college may be referenced. An important part of the media relations work is the relationship part and understanding what media need and why. I do see it as every inquiry as an opportunity to explain to the public what our role is, what our function is, and what our focus is. And finally, on this slide, just a reminder to council that there are only two spokespeople for the college, our registrar and CEO, and the director of communications, me. We support council, and thank you. A number of you recognize the support we provide for you, and we really appreciate that. Meetings, including this one, we are on the stage management team, along with Angie, who's really the star of it, and IT. We help to make sure that this meeting is delivered efficiently and effectively. If you are asked to speak somewhere as part of your role on council, we can help you with presentation remarks. We can help with slides if you need them. And we also offer overall presentation support. Sometimes it's just helpful to talk through what it is you're trying to get across, and we're happy to help you. So our role is to help to ensure that messages are clear, they're consistent, and they're effective. So if you're invited to speak, we're happy to help you. Next slide, please. I'll talk for a moment about social media. We're active on social media, and particularly LinkedIn, where we have over 5,000 followers, and Instagram, where we have 1,700. In the universe of movie stars, that's not very much, but in our universe of regulated health professionals, that's quite good. We monitor other platforms to understand the issues and conversations as they emerge. We look at Reddit and WhatsApp and Facebook and X, but we don't participate in those platforms. We do have a tool for professionals that's sort of a one-pager guide for dentists in navigating their social media activity. It really comes down to 3 words: pause, think, post. Next slide, please. This is just a highlight of, if you don't follow us on LinkedIn or Instagram, please do. You can watch our previous council meetings and our RCDSO Connect sessions on our YouTube channel. Next slide. I've referred to the practice advisory service who are part of the communications team, and I just wanted to give you a little bit of data on how we receive messages in from the public and from dentists. We learn from them every day, I have to tell you. The practice advisory is often the first point of contact for dentists and members of the public. And one of the great things about being on the receiving end of questions is that there's absolutely endless variety and complexity. I meet with the team on a weekly basis, and there is always something new and different that's come up. The volume that you see here on the slide shows strong demand, and this is just for the past 3 months. There's over 550 emails and over 2,250 phone calls. Our service standard is a 2 business day response, but most of the time when we're able, we respond within a business day. Next slide, please. In addition to hearing from the public and patients, those of you who were here at the beginning of 2025, we had a presentation from Pivotal Research. We hired Pivotal to bring us a presentation to do some research on patients and what patients think about their experience going to the dentist's office and what they know about us as the college. So what we found out, which probably won't surprise you, is that most patients are quite satisfied with the care that they receive. Although there are certainly some access and equity issues that remain. Awareness of the existence of the regulator is still limited, especially among non-recent patients. And even fewer, less than 40% of patients are aware of the RCDSO, which means really that our work is cut out for us. So that's why continual improvements to our communications tools, our service, our social media, and our media relations makes sense. Next slide, please. So what's next? We are doing more RCDSO Connect sessions this year. In fact, there's one next week, April 22nd at 7 p.m. on practical pathways to safe, inclusive, and trauma-informed oral health care. In fact, Council Member Dr. Noah Goma is a panelist. So far, 2,200 people have registered, so it will be a great and popular session. You've made a directional decision today around real estate, so we'll be communicating that. There are upcoming elections, so we'll be doing a lot of work around communicating and helping dentists vote. We're hoping to increase turnout this year. Andrea presented on the conclusions of the strategic plan, and we will be helping to draft a report that wraps that up. The annual report is in production, and we will be supporting Andrea's team in communicating the college vision. Next slide, please. In the more distant future, we have planning is underway for a future portal app. Right now, we're really starting conversations around listening and research. Communications and IT are working together to get this rolling. I suspect that the first and most practical use of an app will be standards, but users will tell us what's going to be the most useful application on a handy phone app. Once we get going, it will be groundbreaking. It's not something that other regulators have done. We think it's a great chairside tool that'll make it easier for dentists to access the information we have for them. It's very exciting. It's about meeting our users where they are. Next slide, please. No presentation these days would ought to miss the AI. We are using AI at the college. As you know, we have an AI standard for, or guidance rather, for professionals. So far we use it to make notes, transcribe, get first drafts, and it's been very helpful. AI presents opportunities for us to expand what we do, especially around accessibility and reach from a communications lens. The goal isn't going to be AI for AI's sake, but to provide better service and more accessible tools. So For one example, once we're able to, we're keen to provide more content via video and via audio. If we could do an audio version of our magazine, that would be a great accessibility feature. Again, this is really about meeting our audience where they are. So that's it for my laundry list, and I'm more than happy to take any questions you might have.
Thank you very much for that, Leslie. Anthony Mayer.
Thank you. I promise not to ask a question, so this is not a question. It's just an observation from members. Sometimes get frustrated by the requests from the police, and I found the way that you displayed it in your presentation had real strong emotional reach, and I feel like if you reconstructed those emails so that the members could kind of get a sense of why they're being requested this, I feel like we would get better uptake and people might be less frustrated.
Okay, thank you. I appreciate that.
Thank you. Stephen?
Because I'm relatively new to this, I was looking for your domain name, your website. So RCDSO.org is yours, but .ca is available. So are you concerned, or is there a worry that some bad guys might get the .ca and spoof or try to impersonate your website?
I'm looking to Aldwin, our Director of IT, to better answer that question.
We're always looking to acquire domain names related to us. .ca was previously occupied. We're now trying to work to get the .ca domain properly. But we are not as concerned because we do have mechanisms in place to ensure that we're continuously scanning available domains so they're not being used to maliciously attack individuals claiming to be us.
Thank you. And thanks again, Leslie, for taking the time and for the work you put into the presentation and for all the work you do on behalf of communications, you and your team. At this point in time, we are going to move to item number 13, which is other business. I'm going to quickly scan my computer to see if there are any council members who would like to have something put on the agenda in that section right now. Seeing none, I do want to talk about the fact that there is one parking lot item from our December meeting regarding the 2026 budget. The material for this item is on pages 197 to 200 of the council package. And this is an item for council's information. I'm going to turn it over to Kelly Tripp, the college's Director of Finance. And Kelly, but I hand it to you to review the question and the response that was initiated from that request, please.
Thanks, Hanno. Everyone can hear me okay? Okay, excellent. So this is an information-only update provided in response to questions raised by Council during the 2026 budget presentation in December. The purpose is to clarify how PLP financial results should be understood, explain why budget comparisons can be confusing, and outline the financial risk considerations that ultimately led Council to divest the program. You can put up the next slide. Oh, I didn't even realize the slides aren't up. Sorry.
Hi, Kelly. My apologies. I'm having a little computer trouble. Just give me a few seconds to get your deck up.
Okay. Thanks, Angelo. You can go to the next slide. Okay, so Council reasonably raised questions after seeing modest PLP surpluses in some years, including whether the program may have been supported by the broader fee base. This concern is understandable, and these questions reflect the difficulty in interpreting budget figures without the broader context. So we wanted to clarify and note that the December presentation compared planned budget figures only, not actual results or cumulative experience. Next slide, please. PLP's financial results vary from year to year because malpractice claims are unpredictable and large or complex claims can affect costs long after the coverage year ends. A small surplus in any single year does not necessarily indicate long-term financial stability. PLP also relied on the support from other college functions such as HR, IT, finance, operations, and building infrastructure. However, these costs were not charged directly to the program, rather they were absorbed within the broader college operations. If indirect costs were included, apparent surpluses would be reduced or eliminated. Both volatility and indirect cost support is essential in interpreting why PLP outcomes appeared inconsistent and could result in misleading conclusions about the program's sustainability. Next slide, please. Comparing one budget to another explains planning assumptions, not actual financial results. Budgets are tools used to plan based on expected activity and costs, while actual results reflect what truly happened, including claim timing, actuarial updates, staffing changes, and one-time events. In a volatile program like PLP, budgets and results do not move in parallel, so budget comparisons can appear confusing and should not be read as performance measures. When PLP's actual results are reviewed over time, a clearer picture emerges. From 2017 to 2024, the program was underfunded by approximately $10.6 million, as actual losses exceeded budgeted provisions. This was driven by higher than expected claim severity, exposure to class actions, and delays in recognizing emerging claim trends. Although budgets were increased in later years and a significant fee increase in 2023 produced a short-term surplus, this did not offset earlier underfunding or reduce long-term risk. Viewed cumulatively, PLP financial experience reduced the college's financial flexibility and increased risk, reinforcing the conclusion that isolated surplus years were not indicative of long-term viability. Next slide, please. PLP differs from other college programs because of its requirement for substantial restricted reserves to protect against rare but high-cost claims. A capital adequacy review in July 2023 found that the existing $22.5 million reserve was insufficient, with a 29% risk of a funding shortfall over 15 years, unless additional capital was added. The analysis recommended reserves of at least $29.2 million and ideally $41.4 million, which would have required significant new funding from registrants or from the college's broader financial resources. Given ongoing volatility, past underfunding, rising claim costs, and growing reserve requirements, PLP would have continued to expose the college to material downside risk. Taking all factors together, the decision to divest PLP was based on a comprehensive assessment of financial sustainability, cumulative performance, and risk exposure. Thank you for attention on the final item of our agenda today.
Thank you. Thank you, Kelly. I will take a moment or two to see if there's anyone who has a question of Kelly. Dan? Okay, not of Kelly? Okay. Thanks again for taking the time to come and speak to us, Kelly. It's much appreciated. I see no questions, so I'm going to turn it over to you, Dan, quickly before I go on with the agenda.
Thanks, Hanno. Very quickly, thank you very much, Council. I think we've had a great discussion today on a wide variety of topics. I want to just remind you, every meeting we ask you to fill out an evaluation of the meeting. Not of council, but how it went for you today. And I just want to remind you that we try, under our commitment to transparency, to provide your raw results and the scores across the scales in the packages that are available to the public. So if you have information that you want to share with us that might be more sensitive or it might be confidential from other ways in which you've heard or gathered that information, you're more than welcome to contact myself or the president, and we'll walk through your concerns or suggestions. But I just want to remind you not to put them in the evaluation form because we do put those in the public packages. So thank you.
Thanks for that, Dan. Council, we've come to the end of our agenda. Brief reminder that our next council meeting will be here again. It's going to be on Thursday, June 18th. It is a hybrid meeting. We will be meeting here in person, but there is also the opportunity to attend via Zoom. We will also be live streaming that meeting. And before I call for a motion to adjourn, I would just like to take the opportunity to thank council for their commitment and for their participation today and for their insightful comments and questions, but also a huge shout out to staff, not only the staff that are sitting here in this room, but the staff that are behind the scenes and listening to this. The reality is we couldn't pull off what was pulled off today without the incredible work and commitment that staff has to ensuring that this in fact happens. So thank you to all of you, and not only those of you who are here, but those of you who are listening and or who are not here. So the last item on the agenda is a motion to adjourn the meeting, and that's moved by Deborah, that's seconded by Mark. I'm not going to ask Dan to do a roll call. Just indicate by raising your hands, and I'm going to call that as motion carried. So thank you all very much, and have a great weekend.